Introduction. The decrease of weight in persons who are overweight or obese may minimize health risks, enhance fitness, and even postpone the development of diabetes in some circumstances. It has the potential to reduce pain and enhance mobility in patients who have osteoarthritis of the knee. Weight loss may result in a drop in hypertension, high blood pressure, but it is uncertain whether this would result in a reduction in hypertension-related harm. Weight reduction may be done by following a diet and exercise that entails ingesting less calories than one expends. Individuals who are suffering from despair, stress, or boredom are recommended to seek medical assistance as soon as feasible. According to the studies done in 2010, dieters who had a full night's sleep dropped more than twice as much fat as those who didn't get enough sleep. Even though it has been believed that vitamin D supplementation may be advantageous, examinations have found no evidence to support this. Over the long term, the great majority of dieters gain back the weight they lost. According to the National Health Service of the United Kingdom and the Dietary Guidelines for Americans, people who acquire and maintain a healthy weight do so most effectively by ensuring that they eat just the calories required to fulfill the requirements and participating in physical exercise consistently. If you are someone who feels lost only because you could not lose weight with diet and lifestyle modification and exercise, you need not panic. There is yet a possibility to prevent all the connected morbidities of fat. Use state-of-the-art technology with expert surgeons who aid you with the weight reduction with gastric bypass surgery. Gastric bypass surgery, or bariatric gastric banding, is a surgical technique that modifies the route of the digestive tract. A very tiny pouch is produced near the upper opening of the stomach, which is around 1 ounce or 3 milliliters in capacity. This pouch is linked to the small intestine, where digestive enzymes and stomach acid go down to combine with the meal. Gastric bypass is a form of weight loss surgery that includes generating a tiny pouch from the stomach and connecting the newly produced pouch straight to the small intestine. After gastric bypass, ingested food will flow through this little pouch of stomach and then straight into your small intestine, effectively skipping most of your stomach and the first portion of your small intestine. Gastric bypass is one of the most often performed forms of bariatric surgery. Gastric bypass is done when diet and exercise haven't succeeded or when you have major health concerns due to your weight. Gastric bypass is surgery that helps you lose weight by altering how your stomach and small intestine handle the food you consume. After the procedure, your stomach will be smaller. You will feel full with less food. The food you consume will no longer get into certain regions of your stomach and small intestines that absorb nourishment. Because of this, your body will not receive all of the calories from the food you consume. So let's get started. Chapter number 1, Philosophy of Weight Loss Surgery. 1.1, Philosophy. The gastric bypass procedure significantly lowers the size of the stomach by more than 90%. A natural stomach may expand to over 1,000 milliliters in volume, but the pouch created after gastric bypass may be about 15 milliliters in volume, depending on the patient. Gastric bypass pouches are often created from a section of the stomach that is least prone to straining during the procedure. Because of this, as well as its tiny initial size, there is no considerable change in the pouch volume over time. However, the size of the link between the stomach and the intestine, as well as the capacity of the small intestine to store a higher amount of food, do alter throughout time. By that point, weight reduction should have occurred. An enhanced functional capacity of the pouch should be sufficient to enable maintenance of a lower body weight at the reduced weight. A stretch of the stomach pouch wall, which stimulates neurons that signal the brain that the stomach is full, occurs as the initial reaction when a tiny quantity of food is consumed by the patient. The patient has a sense of fullness, as if they had just had a substantial meal despite having consumed just a thimbleful of food. Despite the fact that the majority of individuals do not stop eating just because they are full, the patient quickly comes to realize that succeeding bites must be taken extremely slowly and carefully in order to prevent worsening pain or vomiting. Before food to travel into the small intestine, it must first be churned up in the stomach. PYY and GLP-1 are both released when the lumen of the small intestine comes into contact with nutrients, while cholecystokinin from the duodenum and GLP-1 from the ileum are both released when the lumen of the small intestine comes into contact with nutrition. These hormones, which are referred to as satiety factors, are known for their ability to prevent future food consumption. Ghrelin is a hormone that is secreted from the stomach and has the effect of increasing appetite and food intake in the body. It has been theorized that changes in circulating hormone levels after gastric bypass would result in weight loss and a decrease in food intake in obese individuals who undergo the procedure. However, these results continue to be debated, and the precise processes by which gastric bypass surgery decreases food consumption and body weight have not yet been determined. For example, it is still commonly believed that gastric bypass works by mechanical methods, such as food restriction or malabsorption, rather than through any other means. According to the findings from recent clinical and animal investigations, many long-held assumptions regarding the processes of Roux-en-Y gastric bypass, RYGB, may not be valid after all. An increasing amount of the research demonstrates that the dramatic changes in body weight and metabolism that occur as a consequence of RYGB are not explained by simple mechanical restriction or malabsorption. One research in rats discovered that RYGB caused a 19% increase in overall energy expenditure, as well as a 31% increase in resting energy expenditure, an effect that was not seen in rats who had the vertical sleeve gastrostomy. Aside from that, pair-fed rats shed just 47% the amount of weight that their RYGB counterparts did. RYGB-induced weight reduction is mostly explained by changes in food consumption after the procedure, and there is no evidence of clinically significant malabsorption of calories contributing to the weight loss. Accordingly, it seems that RYGB causes weight reduction via modifying the physiology of weight control and eating behaviors rather than just by restricting caloric intake or decreasing nutrient intake. The patient should only consume at mealtimes 5 to 6 modest meals daily and should not graze between meals in order to reap the full advantage from this physiology, according to the American Heart Association. It is vital to concentrate on consuming 80 to 100 grams of protein each day. Meals following surgery are 14 to 12 cups, with the goal of getting to 1 cup by the end of the year. Changing eating habits, as well as changing long-established patterns of food seeking, are required to accomplish this. In virtually every instance when weight gain happens late after surgery, the patient's ability to consume a meal has not significantly improved. The patient's actions, such as snacking between meals on high-calorie foods, are often blamed for the weight gain. This is a controversial assumption, and there is a disagreement about it. Others feel that it is unanticipated failure or restriction of the procedure for certain people, and that this is the case, such as reactive hypoglycemia. 1.2. Gastric bypass. Gastric bypass surgery is a method in which the stomach is split into 2 pouches, one tiny upper pouch and one much larger lower remnant pouch, and then the small intestine is modified to link to both pouches. The procedure is performed under general anesthesia. The development of various distinct methods of reconnecting the intestine has resulted in a variety of different gastric bypass surgeries being performed, GBP. A significant decrease in the functional volume of the stomach occurs with any GBP, which is followed by changes in the body's physiological and physical reactions to meals. Morbid obesity, type 2 diabetes, hypertension, sleep apnea, and other concomitant diseases are all treated within this procedure. Not only does the phrase bariatric surgery include a wide range of surgical treatments for morbid obesity, but it also includes gastric bypasses, which are just one kind of bariatric surgery procedure. The subsequent weight reduction, which is often considerable, has a significant impact on comorbidities. It has been shown that the long-term mortality rate of gastric bypass patients may be lowered by as much as 40%. Complications are possible with every surgical procedure. According to a research conducted between 2005 and 2006, 15% of patients have difficulties as a consequence of gastric bypass surgery, and 0.5% of patients died within 6 months following the operation as a result of the issues they had. Among obese adults with or without type 2 diabetes in the United States, a meta-analysis of 174,000 772 participants, published in The Lancet in 2021, found that bariatric surgery was associated with a 59% reduction in all-cause mortality and a 30% reduction in all-cause mortality, respectively. This meta-analysis also discovered that obese individuals with diabetes who got bariatric surgery lived 9.3 years longer than those who received standard non-surgical treatment, but obese persons without diabetes lived 5.1 years longer than those who received routine non-surgical care. 1.3. Benefits of surgery. When is gastric bypass recommended? Gastric bypass is recommended for the surgical treatment of morbid obesity, which is defined as a condition in which the patient is severely obese, has been unable to achieve satisfactory and sustained weight loss through dietary efforts, and suffers from comorbid conditions that are either life-threatening or significantly impair the patient's quality of life. For many years prior to 1991, clinicians considered serious obesity to be defined as weighing at least 100 pounds, 45 kilograms, more than the ideal body weight, which was an actuarially determined body weight at which one was estimated to have the best chance of living the longest, according to the life insurance industry. This criteria was inapplicable to people of low height. The Body Mass Index, BMI, was established in 1991 by the National Institutes of Health, NIH, which funded a consensus group whose recommendations have become the current gold standard for considering surgical treatment, BMI. The Body Mass Index, BMI, is calculated by dividing the body weight by the square of the height in meters. The result is given as a value in kilograms per square meter, with the unit of kilograms per square meter. Among healthy people, the Body Mass Index, BMI, varies from 18.5 to 24.9, with a BMI of more than 30 considered obese, and a BMI less than 18.5 considered underweight. The National Institutes of Health, NIH Consensus Panel, proposed the following criteria for consideration of bariatric surgery, including gastric bypass operations in certain circumstances. Persons with a body mass index BMI of 40 or greater. Persons with a body mass index BMI of 35 or above who also have one or more linked coexisting disorders. Furthermore, the consensus panel stressed that bariatric surgery patients need multidisciplinary care from a team of doctors and therapists to treat related comorbidities, and nutritional, physical activity, behavioral, and psychological requirements. Obesity surgery is best seen as a tool that empowers patients to make changes in their lifestyle and eating habits, resulting in the successful and long-term management of obesity and eating behavior. Several of the panel's recommendations have become obsolete as a result of significant advancements in the area of bariatric surgery, especially laparoscopy, that have occurred since 1991. The American Society for Bariatric Surgery, ASBS, held a consensus meeting in 2004 to update the evidence and findings of the National Institutes of Health, NIH, panel. The participants at this meeting, which included doctors and scientists from both surgical and non-surgical fields, came to a number of findings, including the following. Bariatric surgery is the most effective therapy for those who are suffering from morbid obesity. Gastric bypass surgery is one of 4 kinds of procedures available for treating morbid obesity. Laparoscopic surgery is as successful and as safe as open surgery in terms of outcomes. In order to get the best possible result, patients should have a thorough preoperative exam and receive multidisciplinary assistance. 1.4. Techniques. The gastric bypass surgery, in all of its variations, accounts for a significant portion of all bariatric surgical procedures undertaken. In 2008, it is projected that 200,000 such surgeries were carried out in the United States of America. Laparoscopic surgery is conducted via a series of tiny incisions, or ports, one for the insertion of a surgical telescope coupled to a video camera, and others for the access of specialized operating equipment, among other things. The surgery is being seen on television screen by the surgeon, in addition to laparoscopy being referred to as restricted access surgery. This term refers to the limitations on touching and feeling tissues, as well as the low resolution and two-dimensionality of the video view during the procedure. With practice, a good laparoscopic surgeon can do the majority of surgeries as quickly as an open incision, with the option of utilizing an open incision if the situation calls for it. Despite the fact that Roux-en-Y laparoscopic gastric bypass was first performed in 1993, it is still considered one of the most difficult procedures to perform using limited access techniques. However, the use of this method has greatly popularized the procedure due to the numerous benefits associated with it, including a shorter hospital stay, reduced discomfort, shorter recovery time, less scarring, and a low risk of incisional hernia. 1.4.1 Features that are absolutely necessary. The gastric bypass operation is comprised of the following steps. A tiny 15 to 30 milliliter, 1 to 2 tablespoon, thumb-sized pouch is created from the upper stomach, and the rest of the stomach is bypassed, about 400 milliliters and variable. The amount of food that may be consumed is thus limited. The stomach may be simply partitioned, such as a wall separating 2 rooms in a house, or 2 office cubicles next to each other with a partition wall in between them, and typically by the use of surgical staples. Or it may be completely divided into 2 separated parts, such as a wall separating 2 rooms in a house, or 2 office cubicles next to each other with a partition wall in between them, and typically by the use of surgical staples, also with staples. To lessen the likelihood that the 2 pieces of stomach would merge back together, fistulae, and render the procedure ineffective, total division, separated parts, is typically recommended. Reconstruction of the gastrointestinal system in order to allow drainage of both segments of the stomach to occur. There are numerous varieties of the surgery produced by the specific technology employed for this reconstruction, which varies in the lengths of the small intestine utilized, the extent of which food digestion is impaired, and the possibility of unfavorable nutritional consequences. It is customary to bring up a segment of the small intestine, known as the alimentary limb, until it meets the proximal remnants of the stomach. A gastric bypass treatment is the most regularly used gastric bypass method in the world, and it is also the most often done bariatric procedure in the United States. This is accomplished by dividing the small intestine roughly 45 centimeters, 18 inches, below the lower stomach exit and rearranging it into a Y configuration, which allows food to be expelled from the tiny upper stomach pouch by the roux limb. This proximal variant of the Y intersection is created towards the top proximal end of the small intestine in this configuration. And the roux limb, 80 to 150 centimeters, 31 to 59 inches, of the small intestine are used to form a limb that prevents the remainder and the majority of the intestine from receiving nutrition. In this case, the patient would have a very quick beginning of feeling full in the stomach, followed by an increasing sense of satiety or indifference to food immediately after the commencement of a meal. 1.4.2 Roux-en-Y gastric bypass. The small intestine is usually 6 to 10 meters, 20 to 33 feet in length, depending on the individual. As the Y connection is extended deeper down the gastrointestinal system, the quantity of accessible space for nutrients to be effectively absorbed decreases gradually. But this is exchanged for the operation's improved efficacy. This abnormal formation of the Y connection occurs much closer to the lower distal end of the small intestine, typically 100 to 150 centimeters, 39 to 59 inches from the lower end, resulting in decreased malabsorption of food, primarily of fat and starches, but also of various minerals and fat-soluble vitamins. In the large intestine, unabsorbed fats and carbohydrates may be affected by bacterial activity, resulting in the production of irritants and foul-smelling gases. A somewhat slight increase in overall weight reduction is exchanged for these more significant benefits of nutritional intake. 1.4.3 Mini gastric bypass, MGB. A variant of the normal method, the mini gastric bypass surgery was initially created in 1997 by Robert Rutledge of the United States as part of his research. A small gastric bypass is a procedure that generates a long, thin tube of stomach along the right border of the stomach, the lesser curvature. It is necessary to bring up a loop of the small gut and connect it to this tube about 180 centimeters from the beginning of the intestine. A large number of studies have shown that the loop repair is more safe when performed low on the stomach, but may be disastrous when performed next to the esophagus, near the stomach. Thousands of loops are now being utilized in surgical operations to treat gastrointestinal disorders such as ulcers, stomach cancer, and stomach damage, among others. The mini gastric bypass procedure makes use of the low-step loop reconstruction technique, which reduces the likelihood of bile reflux. MGB has been proposed as an alternative to the Roux-en-Y method because of the ease with which it may be constructed. It is also becoming more popular because of the minimal risk of complications and the ability to achieve significant long-term weight reduction. On the basis of current estimates, the MGB procedure is presently used in 15.4% of all weight reduction surgeries done in Asia. 1.4.5. Bypassing the duodenum and the jejunum using endoscopic. Since the mid-2000s, this approach has been the subject of clinical investigation. An endoscopic duodenal jejunal bypass linear is placed between the beginning of the duodenum, the initial segment of the small intestine that emerges from the stomach, and the mid-jejunum, resulting in a shorter length of small intestines. Due to this blockage, some digestion is prevented from accessing the small intestine's first and early part of the secondary stage, imitating the effects of the Roux-en-Y gastric bypass surgery, biliopancreatic section. Despite a small number of serious adverse effects, such as gastrointestinal bleeding, abdominal pain, and device migration, all of which were resolved by removing the device, preliminary clinical trials have revealed promising results in the treatment's ability to improve weight loss and glucose homeostasis outcomes, according to the researchers. 1.5. Adapting to life after gastric bypass. Gastric bypass surgery has both an emotional and a physiological influence on the person who undergoes the procedure. Many people who have had the surgery experience depression in the months after their procedure as a consequence of a shift in the function that food plays in their mental well-being. Dietary restrictions that are too strict might cause a considerable deal of emotional distress in the sufferer. Energy levels might be low in the days after surgery, both as a result of the limitation of food intake and as a result of unpleasant changes in one's mental condition. It might take as long as 3 months for emotional levels to return to normal. Muscular weakness is also typical in the weeks and months after surgery. Several factors contribute to this, including a reduction in protein consumption, which results in a loss of muscle mass and a decrease in energy levels. Muscle weakness may cause issues with balance, difficulty ascending stairs or moving large items, and greater weariness after doing basic physical activities, among other things. Many of these problems resolve themselves when your food intake steadily rises. The first few months after surgery, on the other hand, may be quite challenging, which is something that is seldom discussed by doctors who recommend the procedure. The advantages and hazards of this operation are well documented. Nevertheless, the psychological consequences of the procedure are still being researched. Even if patients increase their physical activity, they may still have long-term psychological problems as a result of the extra skin and fat. A common follow-up procedure after bypass surgery is body lifts of the skin and liposuction of fatty deposits. These additional operations come with their own set of hazards, but they become much more severe when combined with common nutritional deficiencies that follow gastric bypass patients as they recover from their procedures. 1.6. Deficiencies in essential nutrients. Despite the fact that nutritional shortages are frequently following gastric bypass surgery, they are generally overlooked. They are as follows. Patients with GBP may develop secondary hyperparathyroidism as a result of insufficient calcium absorption, which may be fatal. Due to the operation, calcium is no longer absorbed within the duodenum, which is where it should be. In most patients, supplementation with vitamin D and calcium citrate carbonate may not be absorbed since it needs an acidic stomach, which is not presented in the bypassed stomach, is sufficient to ensure adequate calcium absorption. Iron is usually insufficient in the body, especially in women who are menstruation, and must be supplemented with other nutrients. It is generally absorbed into the duodenum, as previously stated. In typical amounts, ferrous sulfate may produce significant gastrointestinal discomfort, Other forms of iron include ferrous fumarate or chelated form of iron. Occasionally, a female patient can develop severe anemia despite taking supplements and will need parenteral iron to be administered. A lack of iron manifests itself in brittle nails, an irritated tongue, constipation, depression, headaches, weariness, and oral sores, to name a few symptoms. Other signs of the symptoms of zinc deficiency include acne, dermatitis, white patches on the nails, hair loss, depression, and forgetfulness. Zinc insufficiency may also cause lethargy and fatigue. If you have thiamine deficiency, also known as vitamin B1, you run the risk of developing irreversible neurological impairment, also known as Wernicke's encephalopathy or polyneuropathy. A thiamine shortage manifests itself in the form of heart failure, memory loss, and numbness in the hands, constipation, and lack of appetite. Absorption of vitamin B12 is dependent on the presence of intrinsic factors in the stomach mucosa. Pernicious anemia and neuropathies may occur in people who have a small gastric pouch because iron may not be absorbed properly, even when supplemented orally. It has been claimed that vitamin B12 insufficiency is fairly frequent after gastric bypass surgery, with rates as high as 30% in clinical studies. Sublingual B12, cyanobalamin, seems to be well absorbed when taken sublingually. Occasionally, injections of B12 may be required if the sublingual B12 does not deliver enough levels. Protein malnutrition is a legitimate concern. Some patients have persistent vomiting after surgery until their GI system adapts to the alterations, and they are unable to consume sufficient quantities of food even while eating 6 meals a day. In order to avoid an excessive loss of muscle mass during the early stages of fast weight reduction, many patients need protein supplements at this time. Deficiency in the form of protein malnutrition may result in hair loss. Deficits in fat-soluble vitamins, such as vitamin A, are the most common cause of vitamin A deficient individuals. This is often seen after intestinal bypass surgeries, such as jejunal bypass, which is no longer done, or biliopancreatic diversion, duodenal switch procedures, which are no longer performed. Fat absorption is significantly reduced as a result of these operations. With the use of the weight loss medicine Orlistat, there is also the chance of developing a vitamin A deficit. Folate deficiency is also a regular occurrence in people who have had gastric bypass surgery. 1.6.1 Effects of the nutrition of food. Following surgery, patients have the feeling of fullness after consuming just a little amount of food, which is followed by a sensation of satiety and a lack of desire shortly after. The total amount of food consumed has been significantly lowered. Because of the reduced size of the newly created stomach pouch and the resulting reduction of food intake, the patient must adhere to the surgeon's instructions for food consumption, which include the number of meals to be consumed daily, an adequate protein intake, and the use of vitamin and mineral supplements to ensure adequate nutrition. Calcium supplements, iron supplements, protein supplements, multivitamins, prenatal vitamins are sometimes the best choice, and vitamin B12 supplements are all very vital for the post-operative bypass patient's overall health and well-being. Following gastric bypass surgery, the total amount of food consumed and the pace at which food is absorbed will both quickly decrease, while the number of acid-producing cells lining the stomach will grow. Acid-lowering drugs are often prescribed by doctors in order to combat the elevated acidity levels. Many patients subsequently develop a syndrome known as achlorhydria, which is characterized by a lack of stomach acid production. Patients might have an overgrowth of germs as a consequence of low acidity levels in their blood. It was discovered in a study of 43 post-operative patients that virtually all of the patients tested positive for a hydrogen breath test, indicating an overgrowth of bacteria in the small intestine, according to the findings. Bacterial overgrowth alters the ecology of the gut, causing nausea and vomiting as a result of the condition. As a result of recurrent nausea and vomiting, the absorption rate of food gradually changes, leading to vitamin and nutrition shortages that are frequent in post-operative gastric bypass patients. 1.6.2 Nutrition in terms of protein. Proteins are necessary nutritional components found in foods such as meat, fish, chicken, dairy products, eggs, vegetables, fruits, legumes, and nuts. They may be found in foods such as meat, fish, fowl, dairy products, eggs, vegetables, fruits, legumes, and nuts. As a result of their restricted capacity to consume a significant amount of food, gastric bypass patients must prioritize meeting their protein needs first, followed by other nutrients at each meal. The use of liquid protein supplement may be recommended by surgeons in specific instances. Powdered protein supplements, which may be mixed into smoothies or eaten on their own, may be an essential element of a post-operative diet. 1.6.3 Nutrition in terms of calories. The significant weight reduction that happens following bariatric surgery is due to the fact that the patient is consuming far less energy, calories, than the body requires on a daily basis. Fat tissues must be consumed in order to compensate for the deficiency resulting in weight loss. At some point, as the body shrinks, its energy needs decrease, allowing the patient at the same time to consume an increased amount of calories. When the amount of energy consumed equals the amount of calories absorbed, weight loss will come to an end. Proximal GBP often results in a reduction of 60 to 80% of extra body weight, with only a small percentage of cases resulting in severe weight loss. With distal GBP, the risk of excessive weight loss is somewhat higher than the proximal GBP. 1.6.4 Vitamins. Vitamins are often found in meals and nutritional supplements. Following GBP, the quantity of food consumed is significantly decreased, and the vitamin content is cut in proportion to this. As a result, supplements should be used to ensure that the minimum daily needs of all vitamins and minerals are met. The use of prenatal vitamins is often recommended by physicians because they contain higher concentrations of particular vitamins than conventional multivitamins. Absorption of most vitamins is not significantly impacted by proximal GBP. However, vitamin B12 absorption in certain individuals may be inadequate. Sublingual formations of B12 are effective in restoring normal absorption. Some research suggests that GBP patients who take probiotics after surgery are able to absorb and retain larger quantities of vitamin B12 than patients who do not take probiotics after surgery, according to some research. The fat-soluble vitamins A, D, and E may not be adequately absorbed after distal GBP, especially if the patient consumes a high amount of fat. Depending on the individual's physician's suggestions, water-dispersible versions of these vitamins may be advised. Sometimes sublingual vitamin B12 is insufficient for certain people, and they may need B12 injections. 1.6.5 Minerals. All forms of the GBP avoid the duodenum, which is the principal location of iron and calcium absorption, and instead travel via the stomach. Women who are menstrual need iron replacement, while patients who are not menstruating may consider taking an iron and calcium supplement. Ferrous sulfate is a compound that is poorly tolerated. Alternative forms of iron, fumigate, glucometer, and chelates, are less irritating and are likely to be better absorbed than the traditional forms. Caution should be used when using calcium carbonate preparations. Calcium as citrate or glucometer with 1,200 milligrams of calcium has a higher bioavailability independent of stomach acid and will thus be more readily absorbed than the calcium carbonate. Doctors may offer chewable calcium tablets that include vitamin K as a convenient method to receive the calcium you need. 1.6.6 The metabolism of alcohol. Patients who have had gastric bypass surgery require a decreased tolerance for alcoholic drinks as a result of the changed digestive system, which absorbs alcohol at a quicker rate than persons who have not had the procedure. Following the use of alcohol, a post-operative patient's ability to function is impaired for a longer period of time. When 36 post-operative patients and a control group of 36 participants took part in a study, they were asked to drink 1 glass of red wine and have the amount of alcohol in their breath assessed to see how well they were doing with their alcohol metabolism. There was an average peak alcohol breath level of 0.08% in the gastric bypass group, while the control group had an average peak alcohol breath level of 0.05% in the gastric bypass group. It took on average 108 minutes for the gastric bypass patients group to return to an alcohol breath of 0, which it took the control group an average of 72 minutes. Chapter 2. Weight loss by surgery. Gastric bypass, also called Roux-en-Y gastric bypass, is a type of weight loss surgery that involves creating a small pouch from the stomach and connecting the newly created pouch directly to the small intestine. After surgery, food that is ingested will travel into this little pouch of stomach and then straight into the small intestine, skipping the majority of your stomach in the first portion of your small intestine. This procedure is known as gastric bypass surgery. Gastric bypass surgery is one of the most regularly done forms of bariatric surgery, accounting for around 20% of all procedures. When diet and exercise have failed to produce results, or when you are experiencing major health concerns as a result of your weight, a gastric bypass procedure is performed. Gastric bypass surgery is a procedure that aids in weight loss by altering the way your stomach and small intestine process the food you consume. Your stomach will be smaller as a result of the procedure. With less food, you will feel satisfied. Some of the portions of your stomach and small intestine that absorb food will no longer be able to absorb nourishment from the food you consume. As a result, your body will not be able to use all of the calories from the food you consume. 2.1. Procedure for weight reduction surgery. Before this procedure, you will be put under general anesthetic. You will be sleeping and pain-free in no time. During gastric bypass surgery, there are 2 stages to follow. The first stage reduces the size of your stomach or tummy. Your stomach is divided into 2 halves by your surgeon, with the top part being smaller and the lower section being bigger. When you consume anything, the food will go into the pouch, which is the upper region of your stomach. The bag is about the same size as a walnut. It has the capacity of about 1 ounce or 28 grams of food. As a result, you will consume less calories and lose weight. The bypass procedure is the second phase. This is accomplished by connecting a little portion of the smaller intestine, the jejunum, to a small opening in the pouch. All of the food you consume will now go from the pouch to this new opening and then into your small intestinal tract. As a consequence, your body will absorb less calories as a result of this change. Gastric bypass surgery may be performed in one of 2 ways. When you have open surgery, your surgeon makes a wide surgical incision in your abdomen to open it up. Work is done on your stomach, small intestine, and other organs in order to complete the bypass. Another option for doing this procedure is to use a small camera known as laparoscopy. This camera is implanted in your abdomen. The procedure is referred to as laparoscopy. The scope provides the surgeon with a view of the interior of your belly. The following procedures are performed during the surgery. The surgeon makes 4 to 6 tiny incisions in your abdomen. This is where the scope and surgical equipment are introduced in order to execute the procedure. An operating room video monitor is attached to the camera, which is shown on the screen. During this procedure, the surgeon will be able to see within your stomach because of this. The following are some advantages of the laparoscopic surgery versus open surgery: a shorter hospital stay and a speedier return to normal activities, less discomfort, fewer scars, and lesser chance of developing a hernia or infection, and this procedure will take between 2 to 4 hours. 2.2. What is the reason behind this? Gastric bypass surgery is performed to assist you in losing weight and lowering your chance of developing potentially life-threatening, weight-related health conditions such as gastroesophageal reflux disease, coronary artery disease, hypertension, high blood pressure, high levels of cholesterol, sleep apnea, obstructive sleep apnea, diabetic type 2, T2D, stroke, cancer, and infertility. In most cases, gastric bypass is performed only after you've attempted to lose weight by altering your eating and activity habits without success. 2.3. Who is it intended for? In general, gastric bypass and other weight loss operations may be a possibility for you if you meet the following criteria. If your body mass index BMI is 40 or greater, you are overweight, extreme obesity. Having a BMI of 35 to 39.9, obesity, means you are at a high risk for developing a significant weight-related health condition such as type 2 diabetes, high blood pressure, or severe sleep apnea. If your BMI is between 30 and 34 and you suffer from substantial weight-related health issues, you may be eligible for certain forms of weight loss surgery in particular circumstances. However, gastric bypass is not appropriate for everyone who is excessively overweight. In order to be considered for weight loss surgery, you may need to fulfill certain medical requirements. You will very certainly be subjected to a rigorous screening procedure in order to determine your eligibility. You must also be committed to making long-term adjustments in order to live a healthy lifestyle. In certain cases, participants in a long-term follow-up plan may be expected to engage in programs that entail monitoring their diet, their way of life and behavior, as well as their medical issues. Check with your health insurance provider, as well as your local Medicare or Medicaid office, to see what coverage covers weight loss surgery. 2.4. The dangers of weight loss surgery. Gastric bypass and other weight loss procedures, like any other major surgery, include the risk of long-term health consequences. This is true for both the short and long term. The risks involved with the surgical operation are comparable to those associated with any abdominal surgery. They might include the following: excessive bruising and bleeding, infection, anesthesia-related adverse effects, blood clots, problems with lungs or breathing, and your gastrointestinal system is leaking, which is a problem. The following are some of the long-term risks and consequences associated with gastric bypass: obstruction of the bowels, dumping syndrome, which may result in diarrhea, nausea, and vomiting, among other symptoms, gallstones, hernias, hypoglycemia, low blood sugar, malnutrition, perforation of the stomach, ulcers, and vomiting. Complications of gastric bypass are very rare, although they may be deadly. 2.5. How you prepare. If you are having surgery, you may be asked to begin a physical activity program and refrain from using cigarettes in the weeks leading up to the procedure. You may have limits on what you may eat and drink in the days leading up to your surgery, as well as which drugs you can take. Now is a good time to start thinking about how you will recuperate after surgery. For example, if you believe you may want assistance at home, make arrangements for it. 2.5.1. What to expect when you visit. Gastric bypass surgery is performed in a hospital setting. Your hospital stay will normally last 1 to 2 days, although it may be longer depending on your healing process. 2.5.2. During the course of the operation. Before your operation can begin, you will be given general anesthetic to put you to sleep. Anesthesia is a medication that is used to make you sleepy and comfortable while you are having surgery. The details of your gastric bypass procedure will be determined by your unique circumstances as well as the doctor's practices. Some procedures are performed using big, open incisions in your belly, which is a classic method. However, the majority of procedures are done laparoscopically, which involves putting devices into the belly via a series of tiny incisions. A cut across the top of your stomach, sealed off from the remainder of your stomach, is made by your surgeon after incisions have been made using either an open or laparoscopic approach. The resultant pouch is about the size of a walnut and has a capacity of around 1 ounce of food. Normally, your stomach has the capacity to store around 3 quarts of food. In the next step, the surgeon cuts portions of the small intestine and sews it directly into the pouch. This little pouch of stomach is subsequently connected to the small intestine, which allows food to pass straight into the small intestine without passing through it. Rather than passing through a large portion of your stomach and entering into the first area of your small intestine, the food travels straight through and into the middle region of your small intestine. Surgery is normally completed in a few hours. In the surgery recovery area after surgery, medical personnel keep an eye out for any issues that may have occurred during the procedure. 2.5.3. After the procedure. As your stomach and intestines begin to recover following gastric bypass surgery, you may be able to consume liquids but not solid foods for the first several days. After that, you'll follow a customized diet plan that gradually transitions you from liquids to pureed meals. After that, you may start eating soft meals and gradually progress to harder items as your body becomes more used to them. You may be subjected to a variety of restrictions or limitations about how much and what you may eat and drink. A multivitamin including iron, calcium, and vitamin B12 will be prescribed by your doctor following surgery. You should take these supplements as directed by your doctor. During the first few months after weight loss surgery, you'll also have regular medical exams to ensure that everything is going well with your health. It is possible that you may need laboratory tests, blood work, and other procedures. During the first 3 to 6 months after gastric bypass, you may notice changes in your body as it adjusts to the fast weight reduction. These changes may include muscle aches and pains, feeling exhausted as if you had the illness, having a chilly feeling, skin that is parched, hair thinning and hair loss, and shifts in emotional state. Long-term weight reduction is possible with gastric bypass surgery. The amount of weight you lose is determined by the type of surgery you have and the changes you make in your lifestyle habits. It may be able to shed around 70% or possibly more of your extra weight within 2 years after starting the programmer. Furthermore, gastric bypass may help to alleviate and address problems that are often associated with being overweight, such as the following: the condition known as gastroesophageal reflux disease, coronary artery disease, hypertension, which is high blood pressure, high levels of cholesterol, sleep apnea, obstructive sleep apnea, diabetic type 2, T2D, stroke, and infertility. Gastric bypass may also increase your capacity to undertake ordinary daily tasks, which can help you live a better quality of life in the long term. 2.6. When weight loss surgery fails to provide results. It is possible to lose insufficient amount of weight or to gain weight after having weight loss surgery. If you do not adhere to the advised adjustments in your lifestyle, you may experience weight gain. If you snack on high-calorie items on a regular basis, for example, you may have insufficient weight reduction. You must make lasting, healthy modifications to your diet, as well as engage in regular physical activity and exercise in order to prevent regaining the weight. It is critical that you attend all of your planned follow-up visits after weight loss surgery so that your doctor can track your progress. If you realize that you aren't losing weight or if you have issues after your operation, contact your doctor immediately to discuss your options. Chapter number 3. Weight loss surgery and its types. The sort of surgery that may be the most effective in aiding a person's weight loss is dependent on a variety of variables. You should consult with your doctor to determine which kind of surgery would be most appropriate for you. There are following types of weight loss surgeries: gastric sleeve surgery, gastric bypass surgery, and a gastric band that can be adjusted. A fourth procedure, biliopancreatic diversion with a duodenal switch, is performed on a less frequent basis by surgeons. 3.1. Gastric sleeve. Gastric sleeve surgery, also known as vertical sleeve gastrotomy, is a procedure in which a surgeon eliminates the majority of your stomach, leaving just a banana-shaped piece that is closed with staples after being removed. Because this operation lowers the quantity of food that you can fit in your stomach, you will feel fuller sooner after the procedure. It is possible that removing a portion of your stomach will have an effect on hormones or bacteria in your gastrointestinal tract that regulate your appetite and metabolism. It is not possible to undo this sort of surgery since a portion of your stomach has been removed permanently. 3.2. Gastric bypass. 3 phases are required to complete gastric bypass surgery, commonly known as Roux-en-Y gastric bypass. The surgeon begins by stapling your stomach together, forming a tiny pouch in the top region of your stomach. Because the staples make your stomach considerably smaller, you eat less because you feel full sooner as a result of eating less. Following that, the surgeon separates your small intestines into 2 halves and connects the bottom section of the intestine straight to the tiny stomach pouch. Because the majority of your stomach and the top section of your small intestine are bypassed, your body absorbs less calories as a result. Later, the surgeon will reattach the upper portion of the small intestine to a new site on the lower part of the small intestine that is farther down on the lower part of the small intestine. When this occurs, digestive fluids in the stomach are able to move from the bypassed portion of the small intestine to the lower portion of the same small intestine, allowing for complete digestion of the meal. The bypass alters the hormones, bacteria, and other chemicals in the gastrointestinal system, which may have an impact on hunger and metabolism in certain people. Gastric bypass surgery is difficult to undo, yet a surgeon may do it if it's deemed medically essential. 3.3. Gastric band. When you have this sort of surgery, the physician will implant an inflatable ring around the top of your stomach to form a tiny pouch, which you will be able to nurse. The gastric band, like the gastric sleeve in gastric bypass surgery, causes you to feel full when just a modest quantity of food is consumed. The inner band contains a round balloon that is inflated with saline solution and is attached to the outside band. The inner band of the pouch may be resized by the surgeon by injecting or withdrawing saline solution via a tiny device known as a port that is implanted under your skin. Following surgery, you will need a number of follow-up appointments in order to have the band opening size adjusted. If the band causes you discomfort or does not assist you in losing enough weight, the surgeon may decide to remove it. Adjustable gastric band surgery is now less frequent in the United States as compared to other procedures such as gastric sleeve or gastric bypass. This is owing to the fact that it is linked with more problems, the most common of which is the necessity for the band removal due to intolerance. Gastric band surgery, on the other hand, often leads in substantially less weight reduction and is accompanied with more problems, the most common of which is the necessity for band removal owing to intolerance. Biliopancreatic diversion with duodenal switch is a surgical procedure. A surgical treatment known as biliopancreatic diversion with duodenal switch, sometimes known as mixed surgery, consists of two different surgeries that are performed simultaneously. The first treatment is similar to gastric sleeve surgery in that it removes excess stomach tissue. The small intestine tract is divided into two tracts by a second surgical surgery. Food passes via a single tract, skipping much of the small intestine in the process. The quantity of calories and the amount of nutrients absorbed are reduced as a result of this. During the digestive process, digestive fluids pass from the stomach through the other intestinal system and combine with the food as it reaches the colon. When compared to the other three surgeries outlined above, this form of surgery helps you to shed far more weight. The downside is that it is the most likely to result in surgery-related complications and an inadequate supply of vitamins, minerals, and proteins in your body. As a result, surgeons are reluctant to undertake this specific treatment on a regular basis. Some surgeons, on the other hand, may advocate for it for patients who have significant obesity in addition to other medical issues. 3.4. What kind of surgery is it, and how is it done? The majority of weight loss surgeries are performed laparoscopically, which involves just minor incisions and is performed under general anesthesia. Surgeons may introduce tiny instruments and a small scope that is coupled to an imaging camera and displays pictures onto a video monitor via these incisions, allowing for better visualization. There are less dangers with laparoscopic surgery than with open surgery, and it may result in less discomfort and scars. Recovery time after laparoscopic surgery may also be shorter. According to some doctors, an open abdominal surgery procedure, which includes a single major incision in the belly, may be a better alternative than laparoscopic surgery for certain patients. If you have had a high degree of obesity, have had stomach surgery in the past, or have other significant medical concerns, you may need open surgery to correct the problem. 3.5. Expectation before surgery. Prior to surgery, you will meet with a number of healthcare specialists, including an internist, a dietitian, a psychiatrist or psychologist, and a bariatric surgeon, among other people. The internist will ask you questions about your medical history, do a complete physical exam, and prescribe blood tests if necessary. If you smoke, you may benefit from quitting at least 6 weeks before your operation if you do not want to risk complications. The nutritionist will explain what and how much you will be allowed to eat and drink following surgery, as well as assisting you in preparing for the changes that will occur in your life as a result of the operation. A psychiatrist or psychologist may evaluate you to determine whether or not you are prepared to deal with the problems of weight loss surgery, and the surgeon will go through the specifics of the procedure with you, such as how to prepare for it and what sort of follow-up care you will need. Prior to and after surgery, these healthcare specialists will encourage you to increase your physical activity and follow a healthy diet plan as well. Reduce your risk of surgery-related complications by losing weight and reducing your blood glucose, also known as blood sugar levels, closer to normal before your operation. Some weight loss surgery programs provide support groups that you may attend before and after surgery to help answer concerns regarding the operation and to provide encouragement and support to those who are considering the procedure. 3.6. Expectation after surgery. Following surgery, you will need to take time to relax and heal. Moving about the home and taking short walks may help you recover more quickly. Start out carefully and listen to your doctor's recommendations regarding the kind of physical activities you can engage in without harming yourself or others. Increase your physical activity level as you get more comfortable. Following surgery, you will almost certainly be placed on a liquid diet. Following this, you will be transitioned to a soft diet that includes items such as cottage cheese, yogurt, and soup over many weeks. Sooner or later, you will be able to consume solid meals once again. Your healthcare expert will advise you on which meals and drinks you may consume and which you should avoid throughout your treatment. It will be necessary for you to consume modest meals and chew your food thoroughly. If your healthcare practitioner recommends that you take dietary supplements, NIH external link to ensure that you are receiving adequate vitamins and minerals, you should do so. 3.7. How much weight loss after surgery? The amount of pounds lost as a result of weight loss surgery varies from person to person and depends on what kind of surgery performed. The results of one research revealed that those who had adjustable gastric banding, gastric sleeve, or gastric bypass lost between 38 and 87 pounds following a year of treatment. Compared to the other two most popular operations, gastric bypass resulted in the greatest average weight reduction, but it was associated with the most problems in the first month following surgery. The majority of participants gained some weight over time, although the amount was generally little when compared to the amount they had lost initially. It's possible that your weight loss will be different. Remember that achieving your objective is dependent not just on the surgery, but also on your commitment to maintaining a healthy lifestyle. 3.8. Weight loss gadgets. The Food and Drug Administration of the United States has authorized a number of weight loss gadgets that do not permanently alter the structure of your stomach or small intestine. In comparison to weight reduction surgery, these devices produce less weight loss, and some of them are only used briefly, with the goal of teaching patients how to improve their eating habits and physical activity levels. Researchers have not researched any of them over an extended length of time, so they are unable to determine the long-term hazards and advantages of using them. Two methods make use of one or more inflated balloons that are placed endoscopically, or via the mouth and esophagus, to achieve their results. A sedative will be administered by your healthcare practitioner prior to surgery. Once the balloons have been placed in your stomach, they are inflated with saline solution to assist in filling the empty space in your stomach and making you feel fuller. They are designed to be used as temporary solutions while you make modifications to your food regimen and level of physical activity. After 6 months to a year, you will need to have the balloons removed from your body. A more recent balloon device makes it possible to insert an external connection by inserting a bulb in the stomach that is linked to the smaller bulb that is inserted at the far end of the stomach, where it joins up with the small intestine. This device helps to slow down food as it passes through the stomach and into the small intestine. When used in conjunction with a diet and exercise regimen, this gadget is designed to be used temporarily for a maximum of 12 months. After that, the gadget is removed. Another alternative is the use of a gastric emptying device. This is an external link. There are many components to this device, including a tube that runs from the interior of your stomach to a port on the exterior of your abdomen. You connect tubing from the port to a pump and open the valve on the port about 20 to 30 minutes after you finish eating. The pump empties your stomach contents into a tube that leads to the toilet, preventing your body from absorbing around 30% of the calories you ate while eating. The device may be removed in the office at any time, but if it does not seal well over time, it may be necessary to have surgery to close the hole. Chapter number 4, Gastric Bypass Surgery and Diet Plan. 4.1, Gastric Bypass Surgery, Diet After and Before Surgery. Those recuperating from sleeve gastrostomy or gastric bypass surgery, also known as Roux-en-Y gastric bypass, may benefit from a gastric bypass diet, which can aid in the healing process as well as the modification of eating habits. The diet you'll need to follow following surgery will be discussed with you by your doctor or a certified dietitian, who will explain what sorts of foods and how much you may consume at each meal throughout your recovery. Following your gastric bypass diet to the letter will help you lose weight in a safe manner. 4.2. Purpose. The gastric bypass diet plan. You should give your stomach time to recover without putting strain on it via your diet. Prepare you to get used to consuming smaller portions of food that your smaller stomach can easily and securely digest. Assist you in losing weight and preventing weight gain, and prevent any negative consequences or problems from the procedure. 4.3. Dietary specifics. Dietary guidelines after gastric bypass surgery differ based on your specific circumstances. A gastric bypass diet is often followed by a phased strategy to help you gradually return to eating solid meals after the procedure. The speed with which you go from one stage to the next is determined by how rapidly your body recovers and responds to the change in eating habits. Following surgery, you should be able to resume eating ordinary meals around 3 months after the procedure. At each step of the gastric bypass diet, you must take care to avoid the following mistakes. Stay hydrated by drinking 64 ounces of liquid every day to prevent dehydration. Drink liquids in between meals rather than with meals. Drinking anything after a meal should be done roughly 30 minutes later, and drinking anything 30 minutes before a meal should be avoided. Dumping syndrome, which happens when meals and liquids enter your small intestine at a faster rate and in greater quantities than usual, resulting in symptoms such as nausea, vomiting, dizziness, sweating, and diarrhea. Eat and drink carefully to prevent dumping syndrome. Consume lean, protein-rich meals on a regular basis. Make meals and beverages that are low in fat and sugar your first choices. Stay away from alcoholic beverages. Limit your intake of caffeine, which might dehydrate you. Follow your doctor's instructions for taking vitamin and mineral supplements on a regular basis. Once you have progressed beyond drinking merely liquids, chew meals thoroughly until they have a pureed consistency before swallowing them. 4.4. Liquids. If you have surgery, you will only be able to consume clear liquids for the first several days after the procedure. Once you have mastered the technique of handling clear liquids, you may experiment with different types of liquids, such as liquids that you may consume at stage 1 include broth, juice that has not been sweetened, tea or coffee that has been decaffeinated. Milk is a good example of a nutrient-dense food. Sugar-free gelatin or popsicles are available. 4.5. Foods that have been pureed. When you're tolerating liquids for approximately a week, you may start eating pureed, mashed-up meals that have been strained. A smooth paste or thick liquid should be formed from the ingredients, with no solid fragments of food present in the combination. You should aim to have 3 to 6 modest meals every day. 4 to 6 teaspoons of food should be consumed at each meal. Slow down and enjoy your meals, around 30 minutes for each meal. Choose meals that are easy to puree, such as the following: ground beef, chicken, or fish that is lean. Cottage cheese is a kind of cheese that is made from cottage milk. Eggs scrambled to a soft consistency. Cereal that has been cooked. Soft fruit and vegetables that have been cooked. Soups made with creams that have been strained. Solid meals should be blended with a liquid such as water. Skim milk, a kind of milk that has been skimmed. Juice that hasn't been sweetened, or broth. 4.6. Foods that are soft. If your doctor approves, you may begin including soft foods into your diet after a few weeks of pureed meals. Pieces of food that are tiny, delicate, and easily chewed should be the norm. You should aim to have 3 to 5 modest meals every day. Approximately 1/3 to 1/2 a cup of food should be consumed at each meal. Before swallowing, chew each mouthful well until the meal has the consistency of mush. Soft foods include the following: lean meat or fowl that has been ground, fish that has been flaked, eggs, cottage cheese, a kind of cheese made from cottage milk, cereal that has been cooked or dried, rice, canned or soft fresh fruit that is free from seeds and peel, vegetables that have been cooked without the skin. 4.7. Foods that are solid. After around 8 weeks on the gastric bypass diet, you may begin to gradually include firmer foods back into your diet. Make a habit of eating 3 meals a day, each of which should include 1 to 1.5 cups of food. It is critical to quit eating before you reach a state of total satiety. Depending on how well you handle solid food, you may be able to adjust the number of meals you have each day, as well as the quantity of food you eat at each meal. Consult with your dietitian about the best options for you. One new cuisine at a time is the best way to learn about it. Following gastric bypass surgery, some meals may induce discomfort, nausea, and vomiting. These are some of the foods that might create issues at this stage: breads, carbonated beverages, vegetables that are raw, cooked fibrous vegetables such as celery, broccoli, corn, and cabbage. Tough meats or meats with gristle are not recommended. Beef is a kind of red meat. Deep fried foods, foods that are heavily seasoned or hot, nuts and seeds are good sources of protein, and popcorn. It is possible that you'll be allowed to reintroduce some of these foods in the future under the supervision of your doctor. 4.8. A new healthy eating plan. Gastric bypass surgery is a procedure that lowers the size of your stomach and alters the way food enters your digestive system. In order to maintain your weight loss objectives after surgery, it is essential to consume enough calories and nutrients to be nourished. Your doctor is likely to advise you to do the following. Take your time while eating and drinking. For best results, allow at least 30 minutes between meals and 30 to 60 minutes between drinks of 1 cup of fluids to prevent dumping syndrome. Drinking beverages 30 minutes before or after each meal is recommended. Eat modest meals on a regular basis. Consume numerous modest meals throughout the day. After a few weeks of eating 6 meals a day, you could go to 4 meals and eventually 3 meals each day while maintaining your normal eating habits. Each meal should consist of around a half cup to 1 cup of food. Drink plenty of fluids in between meals. Keeping hydrated is essential to staying healthy. You should drink at least 8 cups, 1.9 liters, of fluid every day to stay hydrated. Drinking too much fluid at or around lunchtime, on the other hand, might make you feel bloated and hinder you from eating enough nutrient-dense foods. Take your time chewing your meal. Unlike the old entrance, the new one that travels from your stomach into the small intestine is very thin and may be blocked by bigger bits of food. Obstacles hinder food from exiting your stomach, resulting in symptoms such as nausea, vomiting, and abdominal discomfort. Squeeze little chunks of food between your teeth and chew them until they are pureed consistency before swallowing them. Increase your intake of high-protein foods. Consume these foods first, before moving on to the rest of your meal. Limit your intake of foods that are heavy in fat and sugar. Dumping syndrome is caused by meals that pass through your digestive system fast and generate gas and bloating. Take the vitamin and mineral supplements that are advised. It is likely that your body will not be able to absorb enough nutrients from your diet after surgery. Taking a multivitamin supplement on a daily basis for the rest of your life is almost certainly going to be necessary. Gastric bypass surgery may aid in your recovery and transition to a way of eating that is both healthy and supportive of your weight loss objectives. Always remember that if you return to poor eating habits after having weight loss surgery, you may not lose all of the weight you lost during the procedure, or you may gain back whatever weight you lost. 4.9. Risks. The most serious concerns associated with gastric bypass diet are those associated with improper diet compliance. Having too much to eat or consuming foods that you shouldn't be eating might lead to difficulties. These are some examples. Dumping syndrome is a condition in which someone dumps something on someone else. Experiencing nausea, vomiting, dizziness, sweating, and diarrhea as a result of a large amount of food entering your small intestine too rapidly is not uncommon. It is possible to have nausea or vomiting after eating if you consume too much or too quickly, eat foods heavy in fat or sugar, or do not chew your food well enough. Dehydration. Some individuals get dehydrated as a result of the fact that you are not allowed to consume fluids with your meals. You should drink 64 ounces, 1.9 liters, of water and other fluids throughout the day to keep your body hydrated. Constipation. Constipation may be caused by a lack of physical activity as well as the lack of fiber or liquids in your diet. A blockage at the entrance of your stomach pouches. Even if you strictly adhere to the diet, food might get trapped in the entrance of your stomach pouch. Constant nausea, vomiting, and abdominal discomfort are all signs and symptoms of a clogged stomach opening. If you experience these symptoms for more than 2 days, you should see your doctor. Gaining weight or failing to reduce weight is an issue. If you find that you are gaining weight rather than losing weight while on the gastric bypass diet, see your doctor or nutritionist. 4.10. The Gastric Bypass Diet, a Step-by-Step Guide. 4.10.1. The Importance of Nutrition in Gastric Bypass Surgery. Before having gastric bypass surgery, you must first determine whether or not you are a good candidate for the procedure and understand the risks and advantages associated. In most cases, those who qualify for this procedure are more than 100 pounds overweight or have a body mass index (BMI) more than 35. You may also be eligible if your BMI is between 30 and 35, your health is jeopardized as a result of your weight, and attempting to lose weight via diet and exercise has failed. You should also be prepared to change your eating habits if you want to be a good candidate for the programmer. New food habits may assist you in ensuring that the operation has favorable and long-lasting consequences. Prior to your operation, you must make arrangements for a particular diet that you will follow both before and after the procedure. The pre-surgery diet is designed to help you lose weight by lowering the amounts of fat that is stored in and around your liver. This lowers the likelihood of problems occurring during the procedure. Following the operation, your doctor will customize the general diet recommendations for you. It is common for the post-surgery diet to be divided into multiple weekly periods. It aids in your recovery, as well as meeting the nutritional requirements of your suddenly smaller stomach and establishing healthy eating habits. 4.10.2 Diet before your operation is essential. Losing weight prior to surgery will help lower the amount of fat in and around your liver and abdomen, which is beneficial. This may make it possible for you to have laparoscopic surgery rather than open surgery. Laparoscopic surgery is less intrusive, needs less recovery time, and is less taxing on your body than traditional surgery. The process of losing weight before surgery not only makes you safer during the operation, but it also prepares you for a new way of eating thereafter. Your healthcare physician, with the assistance of a certified dietitian, will decide the specifics of your preoperative diet and weight reduction objective. You may begin your eating plan as soon as you have been approved for the operation. If there is insufficient weight reduction, the treatment may have to be postponed or canceled altogether. It is for this reason that you should begin your weight loss programmer as soon as possible. 4.10.3 Guidelines. Guidelines will differ from one individual to the next, however they may contain the following items. Eliminate or minimize your consumption of saturated fats, which include whole milk products, fatty meat, and fried meals, among other things. Avoid or limit your consumption of carbohydrate-rich foods, such as sweet desserts, pasta, potatoes, bread, and bread products. Eliminate high-sugar drinks, such as juices and sodas, from your daily routine. Learn to regulate your portion sizes. Avoid overindulging in food. Do not use tobacco products. Stay away from drugs that have not been prescribed by your doctor. Stay away from alcoholic drinks. Don't consume drinks with your meals unless absolutely necessary. Take a multivitamin on a regular basis and consume protein drinks or protein powder to keep your muscles strong. 4.10.4 Lifestyle changes after your surgery. It is possible that you may be inspired to begin or continue an exercise regimen. You must allow your body to recuperate immediately after surgery. Take it easy. Low-impact workouts are a recommended choice for the first month of recovery after surgery. Walking and swimming are examples of such activities. Simple yoga postures, stretching, and deep breathing exercises may also be beneficial to your health. Over the following few months, you may gradually increase the amount of time you spend on strength training and aerobic exercises. Consider both mobility and exercise while planning your workout. The following examples of simple lifestyle modifications may help you improve your physical fitness. Take a stroll rather than take the bus, parking a little farther away from where you want to go, and using the stairwell rather than the elevator. Complications that might occur during the procedure. It is possible to prevent issues such as dehydration, nausea, and constipation if you adhere to the right pre- and post-surgery diets. 4.10.5 Obstruction. It is possible that the junction between your stomach and intestines may get restricted at some point. Even if you exercise caution when it comes to what you consume, this may happen. You should contact your doctor if you experience nausea, vomiting, or stomach discomfort that lasts longer than 2 days. All of these signs point to the presence of a potential barrier. 4.11 Dumping syndrome. In addition, eating and drinking slowly may help you prevent dumping syndrome, which is a condition in which your body stores excess sugar and fat in your bloodstream. It is possible to suffer from dumping syndrome if meals or drinks enter your small intestine too rapidly or in excessive quantities. Dumping syndrome may also occur when you eat and drink at the same time, for example. This is due to the fact that it increases intake volume. Dumping syndrome may occur at any point during the post-operative diet. Among the signs and symptoms are sweating, nausea, vomiting, dizziness, and diarrhea. A decent rule of thumb to follow while eating is to allow yourself at least half an hour between each meal. Choose foods that are low in fat and sugar or that contain no sugar at all. Always sip drinks gently and thoroughly, and wait around 30 to 45 minutes before consuming any liquids. The bottom line is as follows. Gastric bypass surgery might provide you with a fresh start in your quest for health and fitness. Following the preoperative and postoperative food recommendations will go a long way towards ensuring your success. In addition to protecting you against surgical problems, eating and drinking properly may teach you how to eat and drink healthily for the rest of your life. 4.12 Reasons why you may need a gastrostomy. Gastrostomy is a surgical procedure that is used to address stomach disorders that have not responded to conventional therapies. Your doctor may propose a gastrostomy to address one or more of the following conditions: tumors that are neither cancerous or malignant, bleeding, inflammation, holes in the lining of your stomach, polyps, which are growths that develop within your stomach, stomach cancer, which is a type of cancer that affects the stomach, peptic or duodenal ulcers that are severe. Some forms of gastrostomy may also be used to treat obesity, depending on the procedure. It takes less time for the stomach to fill when it is smaller. This may assist you in eating less. Gastrostomy, on the other hand, is only recommended as an obesity therapy after all other treatments have failed. Treatments that are less intrusive include diet, exercise, medication, and counseling. 4.12.1 Gastrostomy may be classified into three categories. Partial gastrostomy. A partial gastrostomy is a surgical procedure in which your physician removes the bottom half of your stomach. If you have cancer cells in any of your lymph nodes, they may also be removed by your doctor. Your duodenum will be closed down during this procedure by your surgeon. In your small intestine, the duodenum is the first section that receives food that has been partially digested from your stomach. Once this is completed, the remaining portion of your stomach will be attached to your intestine. Complete gastrostomy. This treatment, sometimes known as a total gastrostomy, involves the full removal of your stomach. Your surgeon will make a direct connection between your esophagus and your small intestine. The esophagus is a tube that links your neck to your stomach in most people. Sleeve gastrostomy. The sleeve gastrostomy is a surgical procedure that removes up to 3/4 of your stomach. You will have the side of your stomach trimmed in order to make it into a tube formed by your surgeon. This results in a stomach that is smaller and longer. 4.13 How to prepare for gastric bypass surgery. Before the procedure, your doctor will prescribe a series of blood tests and imaging studies. These will guarantee that you are in good enough health to undergo surgery. You'll also get a thorough physical examination as well as a review of your medical history. Inform your doctor of any drugs you are currently taking during your consultation. Make sure to include over-the-counter medications and nutritional supplements. It is possible that you may be required to cease taking some medications prior to surgery. As well as being pregnant or suspecting that you could be pregnant, it is important to inform your doctor if you have any other medical issues, such as diabetes. If you are a smoker, you should give up cigarettes immediately. Smoking increases the amount of time it takes to recuperate. It may also lead to greater issues, particularly in the case of infections and lung problems, as previously stated. 4.13.1 The procedure for a gastrostomy is as follows. Performing a gastrostomy may be accomplished in one of two methods. All of these procedures are carried out under general anesthesia. This implies that you will be in a deep slumber during the procedure and will not be able to experience any discomfort. Open surgery. Open surgery is a kind of surgery in which the patient is allowed to see the doctor. Open surgery is performed via a single big excision. In order to get access to your stomach, your surgeon will need to peel back skin, muscle, and tissue. Laparoscopic. Laparoscopic surgery is a kind of surgery that is performed with the least amount of incision. It entails making many tiny incisions and using specialized equipment. In addition to being less unpleasant, this method provides for a speedier recovery period. It is sometimes referred to as keyhole surgery or laparoscopically aided gastrostomy, in certain circles, LAG. In most cases, laparoscopic surgery is favored to open surgery. It is a more sophisticated procedure that has a lower risk of problems than traditional surgery. When it comes to treating some illnesses, such as stomach cancer, your surgeon may prefer open surgery rather than laparoscopic surgery. Chapter number 5, Exercise after weight loss surgery. Exercise is essential in assisting bariatric patients in achieving long-term success in their weight loss objectives. maintaining a healthy lifestyle, and maintaining their ideal weight after they have reached their target weight. In collaboration with your bariatric surgeon and a fitness trainer, it is advised that you establish a program that suits your specific requirements, including your personal preferences, physical ability, and weight reduction and active lifestyle objectives, as well as your overall health and well-being. 5.1. When I may start exercising again. Physical exercise after weight reduction surgery will aid in your recovery by speeding up the process. In addition, it will aid in the improvement of circulation, the prevention of blood clots, the promotion of wound healing, and the improvement of bowel function. During the first week, you should be able to begin walking. Begin by taking several short walks every day to get your blood flowing. You have the ability to walk about the house, shower, and utilize the stairwell at your residence. You should be able to return to the majority of your normal activities within 2 to 4 weeks after having laparoscopic surgery. If you undergo open surgery, it might take up to 12 weeks to recover. Getting out and walking on a daily basis is recommended to boost your physical activity level. You should gradually increase the distance and intensity of your walks as you become more capable, with the goal of walking 10,000 steps every day. It is also possible to participate in aerobic exercise, such as fast walking and bicycling, shortly after having weight reduction surgery. These will be restricted in general by the level of discomfort that these activities give the person participating in them. Once your surgeon has judged the wounds have healed adequately, you may resume swimming. In general, activities that are more rigorous or that require lifting heavy weights are prohibited for the first 3 weeks after surgery. This may vary, thus it is best to check with your surgeon first. 5.2. What physical activity can I perform after weight reduction surgery? You will most likely be given an exercise plan that begins with modest to moderate quantities of physical activity each day, such as 10 minutes per day, before progressively increasing the amount of time spent exercising. When you finish the activity, you should be out of breath, and your heart should be racing quicker than before. When you're ready, you should consider including a range of activities into your program that will improve your endurance, flexibility, and strength, as well as your overall fitness. Combine aerobic workouts, which will help you lose weight and develop muscle, with weight-resistant exercises, which will help you grow and strengthen your muscles. Low-impact workouts such as swimming, cycling, and walking are among the greatest options for you to pick from. Yoga, dancing, running, aerobic courses, and lifting weights are all popular following bariatric surgery, as are other forms of exercise. 5.3. How much physical activity should I engage in? It is advised that individuals strive to be physically active on a daily basis. Every week, exercise should total at least 150 minutes, 2.12 hours, of moderate intensity activity, which should be broken up into 10 minutes or longer bursts. This may be accomplished in 30 minutes on at least 5 days each week, as an example. Alternatively, 75 minutes of strong level exercise distributed throughout the week, or a mix of moderate and vigorous intensity activity, may provide equal health advantages. 5.4. What are the advantages of participating in a fitness program? A healthy lifestyle that incorporates an exercise routine can provide you with several advantages, including the following: keeping the weight reduction going, increasing the rate of your metabolism, reducing your chances of acquiring heart disease and some forms of cancer, for example, increasing your sense of self-worth and self-assurance, assisting in the development and maintenance of muscular strength, endurance, and tone, enhancing joint stability, bone strength, and integrity are all important goals, improving your abilities to carry out your everyday activities, increasing the suppleness of your skin, improving your mood while also lowering stress and anxiety, increasing your general health, well-being, and positive mental attitude. 5.5. Can exercising assist to reduce the amount of extra skin? While weight reduction surgery may effectively remove the fat from your body, it will not cause your skin to regain its tightness and firmness that it had before being obese. In the case of long-term obesity, unwanted folds and rolls of skin may develop, notably around the breast, abdomen, hips, and limbs, as a result of your weight loss efforts. Because these folds and rolls are difficult to keep clean, you may be more susceptible to acquiring rashes and infections as a result of them. Muscular toning will assist you in tightening and firming up your flabby skin and muscles. You may, on the other hand, think about having cosmetic surgery to get rid of the extra skin. It is essential to connect with a consultant plastic surgeon about your cosmetic surgery choices, which may include an apronectomy and breast uplifts before proceeding. Patients who have dropped a significant amount of weight might take advantage of cosmetic surgery alternatives at Ramsay Healthcare. 5.6. I was never a regular exerciser before surgery. May I do so now? If you haven't exercised or been physically active in a long time prior to your weight reduction surgery, it may seem overwhelming to begin an exercise routine after the procedure. Furthermore, being overweight or obese might make it difficult to engage in physical activity. It is critical for you to learn how to work around these mobility restrictions as much as possible. Develop your own fitness regimen that will enable you to go out and be physically active on a regular basis. Replace screen time with time spent working out or resting to boost fitness and energy levels. Take it easy to avoid injuries when you first start out. Taking a 5 to 10 minute walk every day is a wonderful place to start. Slowly increase this amount until you are walking 15 minutes twice a day on a flat surface. If you want to get some exercise, you don't necessarily have to go to the gym. There are a variety of activities available to you, such as walking your dog, gardening, cycling, dancing around the home, cleaning, or participating in sports. Consult with your bariatric surgeon to determine the most appropriate workout regimen for you. 5.7. Tips. Begin your fitness regimen carefully and progressively increase the amount of time you spend exercising. If it becomes easier, increase the number of repetitions, the length of time, or the distance traveled. Remember that if anything causes pain while doing an activity, it is best to quit performing that activity. Set clear, attainable, and reasonable objectives for yourself as part of your workout regimen. Change up your exercises to keep things interesting. Pick physical activities that you love, since you are more likely to stick with them if you enjoy them. Walking, gardening, and cycling are all activities that can be integrated into daily life and are thus more likely to be maintained over time. Determine the most beneficial time of day to exercise. For example, you may like to exercise first thing in the morning or last thing in the evening. Keep your walking shoes or workout clothes in the trunk of your vehicle. Set a goal of walking 10,000 steps each day and invest in a pedometer. Always wait at least 2 hours after eating before beginning an exercise session to prevent indigestion, heartburn, and possibility of acquiring a stitch. Allow your muscles at least 24 hours to rest after an exercise in order for them to be able to fully strengthen and heal. Make sure you drink lots of water. As a result of your surgically reduced stomach, it may be more difficult for your body to absorb the water it needs, particularly during and after activity. Always have a glass of water at your side and consume it on a regular basis. 5.8. Advantages to exercising after weight reduction surgery. 5.8.1. The right kind of weight loss. Exercising may assist you in losing weight and keeping it off after surgery. Weight reduction surgery patients who exercised had their body mass index, BMI, decreased by 4.2% more than those who did not, according to the meta-analysis of research on the issue conducted by the National Institutes of Health, NIH. However, when it comes to reducing weight, it's critical to lose the proper sort of weight. Exercise helps you lose weight while maintaining your lean muscle mass. Christopher Still, director of the Kiesinger Obesity Institute, discusses the importance of exercising after weight reduction surgery and how it might help patients achieve their goals. We lose muscle mass when we lose weight quickly, Dr. Still explains. Exercise is a safe and effective strategy to maintain lean body mass, which helps to keep the metabolism running smoothly and facilitates healthy weight reduction, says the American Heart Association. The natural process of losing weight involves the body eliminating all stored fat and lean muscle mass. It is critical to continue to exercise following bariatric surgery in order to maintain your lean muscle mass. You'll be able to maintain enough muscle to be healthy in this manner. 5.8.2. Exercise's second benefit is that it makes you feel fantastic. Exercise may also help you feel better by giving you more energy and making you feel better. In many cases, our patients express a desire for more than simply weight loss. They want to be able to go on hikes, run 5K races, and play with the grandkids. If that is your ultimate aim, regular exercise after weight reduction surgery may assist you in reaching it. Regular exercise may help to strengthen your heart and bones, lower your blood sugar, boost your immune system, making you less likely to become ill, and make it simpler to handle regular tasks like grocery shopping and other chores. There is additional evidence to suggest that exercise might improve your mental function as well as your physical health. In his book Spark, John Ray, MD, outlines the positive effects that exercise has on improving scholastic achievement and mental function, as well as on alleviating depression and anxiety symptoms. 5.8.3 Exercise third benefit is improved mental health. Exercise releases endorphins, which are neurotransmitters that help you cope with worry and despair. Many patients find the period after their operation to be difficult. If you are obese, you will be looked down upon by many others, and this will leave emotional wounds in its wake. Some individuals feel alone after having bariatric surgery, since so many people in the United States believe incorrectly that it is an easy way out. At the BMCC, we offer support groups to assist you in coping with your emotions after surgery, and many of our patients have said that these support groups seem like a second family to them following their operation. Exercise, on the other hand, may make you feel better. Exercising after bariatric surgery may assist you in coping with stress, worry, and sadness following your procedure. Exercise increases blood flow to the brain, helps to interrupt the brain's downward spirals towards melancholy and anxiety, and releases endorphins, which assist to regulate and enhance your mood when done regularly. Daily exercise, according to Dr. John Raitt, has been proved to be just as helpful in treating depression and anxiety as prescriptions provided by your doctor. Exercise also improves the function of your brain, increases your IQ, and helps to avoid the onset of age-related decline. After your bariatric surgery, you'll meet with your surgeon and your weight reduction team to develop a post-bariatric surgery fitness plan that is specific to your needs and preferences. Throughout the process, our whole team will collaborate to help you lose weight, keep it off, and restore your health. When it comes to exercising after surgery, there are 3 major areas that you should concentrate your efforts on: cardiovascular exercise, strengthening your body, and the ability to be adaptable. Let's go through each of them in detail together. Cardiovascular exercise, cardio, helps you burn calories and gives you more energy. Cardiovascular exercise, often known as cardio, provides a variety of health advantages when performed on a regular basis. It has been shown to increase energy and improve sleep quality. Our bodies are designed to move, and keeping your blood moving in a healthy manner will help you burn more calories and have more energy throughout the day. It may also aid in the reduction of anxiety and the improvement of sleep. Cardio exercise also releases endorphins, which may help you feel more confident. It helps to strengthen your hearts and lungs, as well as promote bone density, which is crucial in preventing arthritis. It also improves your brain clarity and ability to concentrate. What are some of the best cardio bariatric workouts you can do? Walking is suggested immediately after surgery, since it reduces the risk of problems and speeds up your recovery. When it comes down to it, water exercises like swimming may be really beneficial low-impact solutions. Exercising outside, such as running or hiking on a gorgeous Colorado route, may be quite rejuvenating. Listed below is a breakdown and an example of how many calories you'll burn during some common bariatric exercises. Please keep in mind that your specific calorie burn may vary based on your weight and body composition, among other factors. 5.8.4 Maintaining your lean muscle mass through strength training. Strength training is essential for preserving lean muscle mass and preventing muscle loss. By keeping your muscular mass, you are also keeping your body's calorie-burning engine in good working order. It also contributes to the strength of your bones. Strength training is also beneficial for toning and growing muscle, allowing you to be more active and enjoy life to the fullest extent possible. When it comes to strength training, it's crucial to start off gently and build up gradually. Start with 1 to 5 pound weights and gradually increase the weight until you are able to complete 3 sets of 15 to 20 repetitions. If you experience intense discomfort, don't attempt to push through it. Instead, stop and switch to a new activity. Lunges, squats, and weightlifting are all excellent bariatric workouts for building strength. Sit-ups, crunches, and other core workouts may be an effective toning exercise after bariatric surgery, and they can help to build core strength, which can help to avoid problems in the future. 5.8.5 Preventing injuries through flexibility. The importance of flexibility training cannot be overstated in order to prevent injury. After a bariatric exercise, flexibility training might be beneficial if you are feeling sore or tight. In addition, it may assist you in preventing stressing your muscles while you're exercising or lifting weights. Being cautious is essential while you're extending your muscles. Make sure to take each stretch carefully and hold it for 10 seconds at a time. Do not hop about. Push your weight to the point where you feel a burn, but stop if you're experiencing intense pain. 5.8.6 Cardio, burning calories and giving you more energy. It's critical to warm up before each bariatric exercise and to cool down after each one as well. Warming up helps to get your blood flowing and your heart thumping, as well as loosening your muscles before you begin your workout. This will allow you to get the most out of your exercise, while also reducing the risk of injury. Mild stretching, light jogging or walking, or jumping jacks are all good ways to warm up for 5 to 10 minutes before a workout. Make sure to take it easy rather than forcing yourself to do anything. It is recommended that you spend 5 to 10 minutes cooling down after your bariatric exercise. Cooling down will gradually reduce your heart rate and respiration rate down, which will prevent dizziness from occurring. Cooling down also allows your body to clear itself of the lactic acid that it produces following a strenuous exercise, which may be detrimental to your muscles' performance. What are some of the appropriate bariatric cooling exercises to perform after a surgery? Walking and stretching are recommended. Try to gradually reduce your heart rate from activity to resting levels when you finish your workout. 5.9 Exercises to do after surgery. Your body is adapting to the changes that have occurred as a result of weight reduction surgery. That is why it is important to have a regular workout regimen, as well as a nutritious diet that does not do more damage than good to your body. The importance of avoiding overexerting your body too soon after surgery cannot be overstated in terms of your general health and well-being. To help you stay active following weight reduction surgery, we've developed a list of best activities to do in a safe environment. 5.9.1 Walking. Among the most efficient activities for weight loss, walking is often regarded as one of the most beneficial exercises, and with a good reason. Getting started with fitness is a fast, straightforward process for beginners who don't want to feel overwhelmed or have to spend a lot of money on pricey equipment or apparel. This activity also has minimal impact, which means it is less harsh on your joints than other types of workouts. According to Harvard Health, walking an average pace of 4 miles per hour, 6.4 kilometers per hour, for 30 minutes may burn around 167 calories for a person weighing 155 pounds, according to their estimates, 70 kilograms. In a 12-week experiment, including 20 obese women, walking for 50 to 70 minutes 3 times per week for 12 weeks reduced body fat by an average of 1.5% and waist circumference by an average of 1.1 inches, respectively, on a weekly basis. Walking is a basic exercise that can be included into your daily routine without much difficulty. It is possible to obtain extra steps in each day by walking during your lunch break, using the stairs at work, or bringing your dog for additional walks. To get started, aim to walk for 30 minutes 3 to 4 times a week. Increase the duration or frequency of your walks as you become fit is something you can do gradually as your fitness level increases. 5.9.2 Jogging or running. Exercises that promote weight reduction, such as jogging and running, are healthy. Initially, they seem to be identical in terms of speed. However, the key contrast is that the average jogging pace is normally between 4 to 6 miles per hour, 6.4 to 9.7 kilometers per hour, while the average running speed is frequently more than 6 miles per hour, 9.7 kilometers per hour. For example, according to the Harvard School of Public Health, an average weight individual of 155 pounds or 70 kilograms may burn around 298 calories per 30 minutes of jogging at a 5 mile per hour, 8 kilometer per hour speed, or 372 calories per 30 minutes of running at a 6 mile per hour, 9.7 kilometer per hour speed. Research has also shown that jogging and running may assist in the burning of harmful visceral fats, sometimes known as belly fat, which is deposited in the abdomen and is associated with heart disease. Fat that accumulates around your internal organs has been linked to a number of chronic illnesses, including heart disease and diabetes. Jogging and running are excellent weight loss activities because they are not only amazing workouts that can be done anywhere and are easy to include in your weekly schedule, but they are also excellent cardiovascular exercises. For the first few weeks, establish a target of jogging for 20 to 30 minutes, 3 to 4 times a week for a total of 3 to 4 sessions. If you find that jogging or running outdoors is too taxing on your joints, you may want to consider running on softer surfaces such as grass. In addition, many treadmills are equipped with built-in cushioning, which may make them more pleasant on your joints in the long run. 5.9.3. Swimming. Swimming is a pleasant and efficient way to lose weight and get in shape. It also is good exercise. The Harvard Health website estimates that someone who weighs 155 pounds would burn an estimated 233 calories for every half hour spent swimming on average. It seems that the method you swim has an influence on the number of calories you burn during a swim. The backstroke burns 298 calories per 30 minutes. The breaststroke, 372 calories per 30 minutes. The butterfly, 409 calories per 30 minutes. And the treading water burns 372 calories per 30 minutes for a 155-pound human. Following the completion of a 12-week study involving 24 middle-aged women, the researchers discovered that swimming for 60 minutes, 3 times a week, significantly reduced body fat, increased flexibility, and decreased several heart disease risk factors, including high total cholesterol and blood triglycerides, among other benefits. Swimming has had the added advantage of being low impact, which means that it is less stressful on your joints than other forms of exercise. People who are suffering from injuries or joint pain will find it to be a wonderful solution. 5.9.4 Yoga. Yoga is a popular type of exercise that also has the added benefit of stress reduction. Even while not often considered a weight loss exercise, it may burn a large number of calories and has various additional health benefits that may be beneficial in the weight loss process. According to Harvard Health, a person weighing 155 pounds and exercising for 30 minutes would burn around 149 calories according to their weight. Those who participated in 2 90-minute yoga sessions each week observed greater reductions in waist circumference than those who participated in the control group, by an average of 1.5 inches throughout the course of the 12-week trial, which included 60 obese women. After engaging in their yoga practice, the members of the yoga group reported improvements in both their mental and physical well-being. As well as providing calorie-burning advantages, yoga has been shown to increase awareness, which may assist you in avoiding unhealthy meals, controlling overeating, and better understanding your body's hunger signals. Courses in yoga are provided at most gyms, but you are free to practice yoga anywhere you like. It is possible to work from the comfort of your own home due to the wealth of step-by-step instructions accessible on the web. 5.9.5 Pilates. Pilates is a wonderful workout that is suited for beginners and may assist you in losing weight if done regularly. If you weigh 140 pounds, 64 kilograms, and participate in a 30-minute beginner's Pilates class, you will burn 108 calories, according to the study funded by the American Council for Exercise. If you are an advanced Pilates practitioner, you will burn 168 calories over the same period of time. Given that many people find Pilates to be fun, it is simpler to stick with it over time, even if it does not burn nearly the amount of calories that other cardio exercises, such as running or cycling, do. According to the findings of an 8-week study done on 37 middle-aged women, doing Pilates exercise for 90 minutes, 3 times per week, significantly reduced weight, stomach, and hip circumference when compared to a control group that did not exercise over the same period. Beyond helping you lose weight, Pilates has been shown to alleviate lower back stiffness while simultaneously boosting your strength, balance, and flexibility, as well as your stamina, endurance, and overall fitness. You should consider adding Pilates to your weekly routine if you are interested in giving the exercise a try. A Pilates workout may be done at home or at one of the several facilities that provide Pilates instruction on a regular basis. Pilates should be used in conjunction with a healthy diet and other forms of exercise, such as weight training or cardio, to maximize the success of your weight loss efforts. 5.9.6 Cycling. The sport of cycling is a popular kind of exercise that may help you improve your fitness while also helping you lose weight. Despite the fact that cycling is often done outdoors, many gyms and fitness centers include stationary bikes that will allow you to exercise while staying inside and comfortable. Cycling at a moderate speed of 12 to 13.9 miles per hour, 19 to 22.4 kilometers per hour, on a stationary bike burns approximately 260 calories per 30 minutes, according to the Harvard Health. Apart from the fact that it is beneficial for weight loss, studies have shown that those who bike regularly have greater overall fitness, improved insulin sensitivity, and a lower risk of developing heart disease, cancer, and mortality when compared to those who do not cycle regularly. Cycling is a fantastic sport for people of all fitness levels, from novices to elite athletes, and it is accessible to everyone who wants to participate. Furthermore, because it is a non-weight-bearing and low-impact exercise, it will not place a significant amount of strain on your joints. 5.9.7 Weightlifting is a sport that involves lifting heavy weights. Using dumbbells for mild weightlifting exercises after weight loss surgery may make it simpler to gain muscle mass after weight loss surgery. Lifting just 2 to 5 pounds at a time will allow your body to get used to the new weight. After consulting with your doctor about when you should begin lifting larger weights, you may make the necessary adjustments to your workout program. Lifting larger weights should be avoided unless you have spoken with your doctor about it. 5.9.8 A fitness ball. Exercise ball exercises may be done to help you keep healthy after weight reduction surgery, since they are not as strenuous as traditional workouts. The use of an exercise ball is only suggested after a period of about 1 year after surgery. You may try doing balancing push-ups or crunches with a ball, but first speak with your doctor to see which exercises are most safe to undertake. 5.9.9 Body Blade. This is specialized rehabilitation equipment that employs vibrations and inertia to help you get your body back in working order. Despite the fact that you must acquire the body blade, this instrument helps you to work out muscles that are difficult to reach. As you move the body blade back and forth, your muscles are put through their paces against both resistance and balancing challenges. 5.9.10 Kickboxing is the eighth sport. This is another exercise that you should try after a period of time has passed following your weight loss procedure. This can aid in the development of muscle and balance. Kickboxing is a terrific technique to get rid of any stress you may be feeling while also being physically active. Maintain a safe distance between your body and the exercise until you have spoken with your doctor about when this activity is safe for you to undertake. 5.9.11 Zumba. Activities are not a punishment, and hence certain enjoyable workouts may be quite beneficial to your health. Zumba exercises are a high-intensity form of physical activity. It contributes to enhanced cardiovascular fitness, reduced cholesterol levels, lower blood sugars, and the rapid melting of abdominal fat. According to the American College of Cardiology, ACE research, 19 healthy ladies between the ages of 18 and 22 participated in a Zumba session while wearing a cardiac monitor. 9.5 calories per minute on average were burnt by the ladies, which is more than 8.5 calories per minute burned in prior tests of advanced Pilates courses, power yoga, step aerobics, and cardio kickboxing, among other activities. So put on some music and be ready to start your Zumba exercise right now. In addition, check out these 7 exercises for a successful leg day at the gym. 5.9.12 Leg workouts that are performed vertically. Leg lifts are excellent for toning your abdominals and obliques. Increased stability and strength, as well as the loss of body fat and toning of the body, are all benefits of this exercise. Leg lifts entirely isolate the rectus abdominis muscle, which aids in the toning of the abdominal muscle. Lie down on your back with your hands just below your hips, palms facing up. Then carefully raise your legs to a 90-degree angle with your body. Maintain a straight line between your knees and your feet, pointing to the ceiling. After a brief pause, slowly drop your legs back to the ground while exhaling. Try this super effective workout as soon as possible. 5.9.13 Aerobic Exercise. High-intensity aerobic exercises are an excellent way to eliminate abdominal fat without having to visit the gym. These exercises are efficient, easy, and enjoyable, and they are excellent for burning most calories possible. 5.9.14 Crunches. Dietary crunches are the most efficient workout for burning tummy fat. When it comes to fat-burning workouts, crunches are at the top of the list. The best place to start is by laying down flat on the ground with your knees bent and your feet flat on the ground. Your hands should be raised and then placed behind your head. If you choose, you may keep them crossed over your chest as well. Maintain awareness of your breathing rhythm. This exercise will also aid in the development of abdominal muscles as well as the reduction of body fat. 5.9.15 Burpees. According to Michaels, this workout strengthens your core as well as your chest, shoulders, triceps, and quadricep muscles. Burpees will also get your heart beating since they include intense plyometric action. Burpees are performed by standing with your feet shoulder distance apart and bringing your hips back as you drop your body toward the ground in a low squat position. Afterwards, lay your hands just outside of your feet and bounce your feet back until your torso touches the ground. Make a plank with your body by pressing your hands to the floor, then hop to your feet slightly outside of your hands to complete the move. Take a powerful leap into the air with your weight on your heels and your arms extended above to finish. 5.9.16 Mountain Climbers. This moving plank workout, like burpees, is a favorite of Michael's because it targets your core muscles as well as a plethora of other muscles throughout your body. How to do mountain climbers. Get into a high plank posture with your wrists squarely under your shoulders and your elbows directly under your shoulders. Make sure your core is firm and that your belly button is drawn in towards your spine. Carry your right leg all the way up to your chest and then bring it back to plank position. Drive your left knee towards your chest and then bring it back to your starting position. Continue to switch sides as needed. 5.9.17 Burpees with a medicine ball. The addition of a medicine ball to your burpees will increase the intensity of the exercise while also increasing your metabolism, all while resulting in a sleek set of six-pack abs, according to Phelps. The proper way to do medicine ball burpees is to stand with your feet shoulder distance apart and grip a medicine ball in both hands while standing. Swing the ball high and smash it down as hard as you can on the ground, hunching over and sitting your buttocks back as you slam the ball. Bend your knees as you come to a full stop. Jump back into a high plank posture by placing your hands on the ground outside your feet and jumping back into position. Maintain a straight line with your body, then jump your feet backwards towards the outside of your hands, resulting in a squatting position on your hands. Pick up the ball and press it overhead, extending your body and standing tall. 5.9.18 Sprawls. The sprawl is basically a burpee on steroids. A full body exercise that works as many muscles as possible and burns calories while shaping and toning upper and lower body, especially your abs. This variation of standard burpees elevates it to a higher level by requiring you to put your chest to the ground and then push up to plank while you repeat the action, according to Braganza. A sprawl is performed by standing with your feet shoulder distance apart, squatting down, and placing your hands on the ground. Jump your feet back to a plank position and lower your body until your body is parallel to the ground. To begin, raise yourself to a plank position and then hop your feet outside of your hands to begin in a squat position. Regain your balance. That's 1 rep for you. In order to burn even more calories, Braganza recommends adding a leap between each sprawl. Chapter number 6, The Benefits and Drawbacks of Gastric Bypass Surgery. There are 2 phases to gastric bypass surgery. The stomach shrinks to a capacity of around 30 to 50 milliliters during the first stage. The final intestine connects the top and lower ends of the body. As a result, both the quantity of food consumed and the amount of food that may be digested are lowered in this manner. The quantity of calories that enter the body is kept to a bare minimum. The following is a summary of the pros and disadvantages of gastric bypass surgery, as well as extensive information regarding the procedure. 6.1. The benefits of gastric bypass surgery. Following gastric bypass surgery, patients are urged to adhere to a strict diet and exercise regimen on a daily basis. The patient's ability to comply with this directive is critical to the outcome of the procedure. The following are some of the benefits of gastric bypass. Permanent weight reduction is more long-lasting than temporary weight loss. It limits the quantity of food that may be drained at any one time. It has the potential to create circumstances that contribute to increased energy usage. There are favorable changes in gut hormones as a result of this treatment, which help to decrease hunger and improve fullness. High blood pressure decreases in severity. 70% of people are able to totally discontinue their blood pressure medications on their own. The level of cholesterol in blood decreases. In 80% of patients, it has been reported that their cholesterol levels have decreased. The readings have returned to normal 23 months after the procedure. The likelihood of developing heart disease decreases. Only a small percentage of people with type 2 diabetes are needed to take medication. Diabetic patients are entirely healed of their disease. When asthma episodes are considerably decreased, and in some people they are totally eliminated, this is a significant improvement. Breathing issues usually subside within a few months of surgery being performed. As a result of their breathing issues, many patients are able to resume activities and daily routines that they were previously unable to do. Obesity-related sleep problems such as sleep apnea syndrome, which are common among the obese, vanish. Acid reflux disease is no longer present. Weight reduction achieved with this approach is permanent, provided that the procedure is followed to the letter. 6.2. Drawback of gastric bypass. Gastric bypass surgery will almost certainly result in a variety of negative effects. Surgery may potentially interfere with a variety of metabolic processes, resulting in a variety of complications. Aside from that, it is an expensive treatment option that is not covered by private health insurance plans. The following are some disadvantages of gastric bypass surgery. Sleeve gastrostomy is a technically more complicated process than traditional surgery, and it has the potential to result in more serious consequences. It has the potential to cause long-term vitamin and mineral shortages, particularly in the areas of vitamin B12, iron, calcium, and folate. In general, a sleeve gastrostomy requires a lengthier hospital stay than a traditional gastrostomy. Following dietary guidelines, receiving lifetime vitamin and mineral supplementation, and adhering to follow-up procedures are all required. An increase in the number of urinary infections occur. Constipation or blockage of bowels can occur. Suppression of the stomach's natural expulsion. Following the surgery, the stomach's outflow is significantly reduced in size. Congestion-causing foods, such as those that are not chewed thoroughly, are accessible in this area. Any bite that is greater than the output poses a danger of obstructing the flow of food. Nutrient deficits that last for a long time. Nutritional inadequacies such as vitamin and mineral deficits. Nausea, alteration in bowel habits, alopecia areata, a reduction in the month of November, the development of gallbladder stones and hernias as a surgical location. It is very hard to recycle surgery. The possibility of a multitude of significant complications that might result in death. Chapter number 7. Low-carb recipes after gastric bypass. 7.1. Carbohydrate content is lower. The majority of low-carb cereals are not significantly low in carbs. Cereals are mostly composed of grains, and grains are carbohydrates. Some cereals, on the other hand, have less carbohydrates than others. Products with reduced carbohydrate content that you are likely to find in most grocery shops include 7.1.1 Cheerios. Cheerios contain about 20.50 grams of carbs per cup of cereal. They are also gluten-free, which is great for anyone who are managing their gluten consumption. 7.1.2 Wheaties. Wheaties have been around since 1922, and they are still a favorite today. They're also quite low in carbs when compared to other cereals, including just 23 grams of carbohydrates per 3/4 cup meal. 7.1.3 Special K Original. Because it contains just 22.75 grams of carbs per cup, Kellogg's Special K cereal is a low carbohydrate option. 7.1.4 Annie's Organic Frosted Oat Flakes. Little ones and adults alike like this organic, low-carb, gluten-free cereal that is made with organic ingredients. A serving of 3/4 cups includes about 27 grams of carbs, which is approximately 9% of the daily recommended requirement. It should be noted that some cereal producers use a 1-cup serving size, but others use a 3/4 cup serving size, see below. With proper portion control, there's no reason you can't enjoy a bowl or two of the best option cereals many times each week if you keep to the suggested serving size. 7.1.5 Purpose of carbohydrates in the body. Carbohydrates are one of the 3 primary nutrients required by the body to operate properly. Fat and protein are the other 2 components. Carbohydrates are broken down into glucose, which is necessary for the body to function correctly since it provides it with the energy it requires. Every cell in the body has the ability to utilize glucose as a fuel source. Carbohydrates are classified into 3 types: simple, complex, and dietary fiber. Starches, which are carbohydrates, are with a complicated structure. Carbohydrates that are simple in nature, including sugars, and fiber. Due to the fact that complex carbohydrates are broken down at a slower pace than simple carbohydrates, they give the body with a more consistent and long-lasting source of energy. They may be found in the following places: whole grains, that are a kind of grain that has all of the grains in their natural state; beans, and vegetables that are a high starch content, such as maize and potatoes. These carbohydrates also serve as a source of energy for beneficial bacteria in the colon. They are involved in the following activities: the overall health of your immune system, metabolism, the possibility of developing a chronic illness, and gastrointestinal well-being. Because simple carbs are easily absorbed by the body, they give a swift and short-term energy boost. Simple carbs may be found in the following foods: milks, fruits, foods that have been processed and have added sugars. Fiber is vital because it aids in the maintenance of a healthy digestive system. 7.1.6 How many carbohydrates should you consume every day? While carbohydrates are necessary for everyone, some individuals need more carbohydrates than others. As an example, those who engage in physical activity need more carbohydrates than others who do not engage in such activity. Those suffering with diabetes are often needed to restrict the quantity of carbs they eat at each meal in order to keep their blood sugar levels under control. In an effort to accelerate weight reduction, those following low-carb diets, such as those promoted by Atkins, ketogenic, and South Beach diets, may restrict their carbohydrate consumption. Carbohydrates aren't inherently bad, but it's important to consider how much your body needs each day in order to be healthy. The quantity of carbs you need is determined by the following factors: age, sex, the state of one's health, and the amount of activity. Individuals should consume between 45 and 65% of their daily calories from carbohydrates, with more active people erring on the side of consuming more carbs and less active people consuming less carbs, according to some health experts. In order to maintain their weight, an average-sized individual between the ages of 19 and 25 should eat around 2,400 calories per day, which includes 270 to 390 grams of carbohydrates. Afterwards, a mix of fat and proteins should account for 35 to 55% of their overall calorie intake. A recommended serving of carbs contains around 15 grams of carbohydrates. Following are some samples of suggested servings according to the American Heart Association trusted source: 1 piece of sourdough bread, a 1/3 cup of cooked rice, half a banana, a single tiny potato. This suggests that for a daily carbohydrate intake ranging from 270 to 390 grams, you would need to eat between 18 and 26 suggested amounts. Always keep in mind that not all calories and carbohydrate grams are created equal. For better or for worse, choosing healthy carbohydrates versus high-sugar, low-fiber carbs might be beneficial in terms of maintaining or improving general health. 7.2 Recipes for breakfast. 7.1.1 Omelet with spinach and goat cheese. Ingredients: 3 big quail eggs, 2 teaspoons, approximately 30 milliliters, heavy cream, 1 cup, around 30 grams of fresh spinach, goat cheese, 1 ounce, 28 grams, 1 pound of goat cheese, 1 tablespoon, 14 grams of melted butter, optional. Season with salt and pepper to taste. Directions: in a large mixing bowl, whisk together the eggs, heavy cream, salt, and pepper until well combined. In a medium-sized skillet, Melt the butter and saute the spinach until it has wilted. Stir the spinach periodically until it reaches a dark green and wilted color. Remove the pan from the heat and put it aside. Pour the egg mixture into the pan and cook over medium heat until the eggs are set. Once the eggs have begun to set, carefully turn them over with a spatula. To half of the omelet, fold in the spinach and goat cheese. Once the omelet has set, fold it in half and cut it into slices to serve. 7.2.2 Frittata with vegetables. Ingredients: 6 quarts of big eggs, a third of a cup 80 milliliters of milk, season with salt and pepper to taste, 4 garlic cloves, peeled and minced, 2 cups or 60 grams of finely chopped kale, 2 cups or 300 grams chopped bell peppers, 1 ounce 28 grams of feta cheese crumbled, 1 tablespoon 15 milliliters of extra virgin olive oil. Directions: preheat the oven to 400 degrees Fahrenheit, 205 degrees Celsius. In a separate bowl, whisk together the eggs, milk, minced garlic, salt, and pepper, and put the mixture aside. In a 10-inch, 25-centimeter oven-safe pan, heat the olive oil over medium heat until shimmering. Cook the chopped kale and bell peppers, turning periodically for 5 to 7 minutes or until the kale and peppers are softened. Pour in the egg mixture, tilting the skillet to ensure that it is distributed evenly. Sprinkle the feta cheese on top of the dish. Bake in the skillet for 15 to 20 minutes or until the eggs are set before seasoning, slicing, and serving. 7.2.3 Avocado eggs baked in the oven. Ingredients: 1 avocado, 2 big eggs. Season with salt and pepper to taste. Optional garnishes such as bacon pieces, cheese, chives, cilantro, or tomatoes. Directions: preheat the oven to 400 degrees Fahrenheit, 205 degrees Celsius. Cut the avocado in half lengthwise. Remove the pit, then use a spoon to scoop out some of the flesh from the center of the avocado to make the hole larger. Crack 1 egg into each of the holes. Season with salt and pepper, and then top with your favorite toppings. Bake for 10 to 15 minutes, then remove from the oven and serve. 7.2.4 Shakshuka. Ingredients: 6 quarts of big eggs, 1 medium-sized onion chopped, 1 red bell pepper peeled and diced, 3 garlic cloves peeled and minced, the contents of a 28-ounce, 794-gram can of diced tomatoes. Season with salt and pepper to taste. 1 tablespoon or 7 grams of paprika chopped. 1/2 teaspoon or 1 gram of ground red chili pepper powder. 1 teaspoon, 2 grams of cumin. 2 ounces, 57 grams of feta cheese crumbled. 1 bunch of cilantro finely minced. Directions: heat the oil in a pan over medium heat until shimmering. In a large skillet, heat the chopped onion and bell peppers for 3 to 5 minutes or until the onions are translucent. Add the tinned tomatoes and juice to the pan and stir well. Toss in the minced garlic and seasonings, including pepper and cayenne, and bring the mixture to a simmer. Make tiny holes in the mixture with a spoon and crack an egg into each one. Cover the pan and heat for 5 to 10 minutes or until the eggs are cooked to your preferred doneness, stirring occasionally. Garnish with feta and cilantro before serving. 7.2.5 Low-carb pancakes are a great option. Ingredients: 2 big eggs, 2 ounces, 57 grams of cream cheese, 2 to 4 grams of stevia extract or 1 to 2 tablespoons, 1 teaspoon or 5 milliliters of vanilla essence, 2 teaspoons or 30 milliliters extra virgin olive oil. Directions: in a blender or food processor, pulse the ingredients until they are completely smooth. Melt the olive oil in a pan over medium heat, stirring constantly. Pour a quarter of the batter into the pan and cook for 2 to 3 minutes or until the batter is golden brown. Cook for 1 minute on the other side or until the second side is golden brown. Repeat the process with the remaining batter, then top with butter, sugar-free syrup, sugar-free jam, fresh berries, or yogurt as desired. 7.2.6 Granola bars that are devoid of added sugar. Ingredients: 1/2 cup 75 grams almonds, 1/2 cup 60 grams walnuts, 1/4 cup 40-gram hemp seeds, 1/4 cup 23 grams unsweetened coconut flakes, 1/4 cup 43 grams sugar-free chocolate chips. 1/4 cup, 60 grams of almond butter, 1 big egg, 4 tablespoons of the extract of monk fruit, 2 teaspoons, 10 milliliters of vanilla extract, a pinch of salt to taste. Directions: preheat the oven to 350 degrees Fahrenheit, 180 degrees Celsius. Place the almonds and walnuts in a food processor and pulse until finely chopped. After a few pulses, the nuts should roughly be chopped into big bits. In a large mixing bowl, combine the chopped nuts with hemp seeds, coconut flakes, salt, chocolate chips, and monk fruit. Set the mixture aside for 30 minutes. In a separate dish, whisk together the egg, vanilla essence, and almond butter until well combined. Pour the mixture into the bigger mixing bowl with the nuts and seeds after whisking it together. Then press the mixture into a baking sheet lined with parchment paper, pressing it down hard until the granola mixture is well compressed. Bake for 15 to 20 minutes or until the center is completely set, then let to cool completely before cutting and serving. 7.2.7 Protein muffins with low carbohydrates. Ingredients: 2 cups, 224 grams of almond flour, low-carb protein powder in the amount of 1/4 cup, 30 grams, 1/2 cup, 100 grams of granulated sugar substitute such as monk fruit to taste, 1 teaspoon, 5 grams of baking powder, 4 tablespoons, 56 grams melted butter or margarine, 1/2 cup, 120 milliliters unsweetened nut milk, 3 big quail eggs, 1 teaspoon, 5 milliliters of vanilla essence, 2/3 cups, 115 grams sugar-free chocolate chips. Directions: preheat the oven to 350 degrees Fahrenheit, 180 degrees Celsius. Prepare a muffin tray by lining it with cupcake liners. In a large mixing bowl, whisk together the almond flour, protein powder, sugar alternative, and baking powder. Gradually incorporate the melted butter, nut milk, eggs, and vanilla extract, finishing with chocolate chips at the end. Spoon the batter into each lined muffin cup in an equal layer. Bake the muffins for 20 to 25 minutes or until a toothpick inserted into the middle of the muffin comes out clean. 7.2.8 Waffles made with almond flour. Ingredients: 1/2 cup, 56 grams almond flour, 4 big quail eggs, 1 teaspoon, 5 grams of baking powder, 2 teaspoons, 24 grams of monk fruit extract, 1/3 cup, 82 grams of plain Greek yogurt, 1 tablespoon, 14 grams melted butter. Directions: place all the ingredients in a blender or food processor and mix until completely smooth. Preheat a waffle machine to medium heat. Cook until the waffles are golden brown and crisp around the edges, using 1/4 cup of the batter at a time. Repeat the process with the remaining batter and serve with berries, sugar-free syrup, or sugar-free jam on top if desired. 7.2.9 Breakfast salad. Ingredients: 2 cups, 60 grams of spinach, 2 boiled eggs, hard-boiled, 1 ounce, 28 grams of shredded mozzarella cheese, 1 Roma tomato, peeled and sliced, half an avocado, thinly sliced, 2 teaspoons, 30 milliliters, extra virgin olive oil, 1 tablespoon, 50 milliliters, freshly squeezed lemon juice. Season with salt and pepper to taste. Directions: in a large mixing bowl, combine the spinach and top with eggs, mozzarella, tomatoes, and avocados. To create the dressing, mix together the olive oil, lemon juice, and a pinch of salt and pepper in a bowl. Drizzle the dressing over the salad and place it on a serving platter. 7.2.10 Stuffed bell peppers with variety of flavors. Ingredients: 2 medium-sized bell peppers, 4 big quail eggs, 1/2 cup, 55 grams shredded mozzarella cheese. Season with salt and pepper to taste. 2 pieces of bacon, fried till crispy and crumbled. 1 cup, 30 grams of spinach, finely chopped. Directions: preheat the oven to 350 degrees Fahrenheit, 180 degrees Celsius. Cut each bell pepper in half lengthwise, and then remove the stalk and seeds from the inside of each half. Place them on a baking sheet that has been buttered and put them aside. In a small mixing bowl, whisk together the eggs, bacon, spinach, salt, pepper, and 1/4 cup, 28 grams of the cheese until well combined. Spoon the egg mixture into each bell pepper being sure to distribute it evenly. The remaining cheese should be sprinkled on top. Place in the oven for 35 to 45 minutes or until the eggs are cooked through. 7.2.11 Tofu Scramble. Ingredients: 16 ounces, 454 grams extra firm tofu, 2 tablespoons, 22 grams nutritional yeast, 2 teaspoons, 28 milliliters extra virgin olive oil, half of a red onion, finely diced, half of a red bell pepper, finely diced, 4 garlic cloves, peeled and minced, 2 cups, 60 grams, finely chopped spinach. Season with salt and pepper to taste. Directions: drain the tofu and squeeze out any leftover moisture by patting the block dry, putting it on a dish covered with a paper towel, and pressing it for 10 to 15 minutes with a heavy item on top. In a large mixing bowl, crush the tofu into tiny pieces using a fork and put it aside. Heat the olive oil in a pan over medium-high heat, then add the onions and garlic and cook for 2 to 3 minutes until the onions are translucent. Toss in the bell pepper and spinach and mix well. Cook until the spinach is dark green and wilted, about 5 minutes. Pour in the crumbled tofu and simmer for 3 to 4 minutes, turning regularly to break up big clumps of tofu until the tofu is soft. Before serving, stir in the nutritional yeast and season with salt and pepper to your liking. 7.3 Recipes for Lunch. 7.3.1 Nutty Chicken Sauté Strips. Ingredients: 2 tablespoons peanut butter, 1 garlic clove, peeled and shredded finely, 2 teaspoons Madras curry powder, a couple of shakes of soy sauce, 2 tablespoons lime juice, 2 skinless, boneless chicken breast fillets, about 300 grams sliced into thick slices, a 10-centimeter cucumber sliced into finger-sized pieces, a sweet chili sauce to be used as a condiment. Direction: preheat the oven to 200 degrees Fahrenheit, 100 degrees Celsius, and line a baking pan with nonstick paper. A bowl filled with 2 tablespoons chunky peanut butter, 1 finely chopped garlic clove, 1 teaspoon Madras curry powder, a few dashes of soy sauce, and 2 tablespoons lime juice. Some nut butters are thicker than others, so if required, thin them with a little amount of boiling water to get a coating consistency before using. Mix in 2 skinless chicken breast fillets cut into strips and 2 cups of water until fully combined. Place the chicken breasts on a baking sheet, spaced apart, and bake for 8 to 10 minutes or until cooked through but still moist. Serve hot with a 10-centimeter cucumber slice into fingers and drizzle of sweet chili sauce on the side. Alternatively, let it cool before storing in the refrigerator for up to 2 days. 7.3.2 Soup with Celery. Ingredients: 2 tablespoons extra virgin olive oil, 300 grams celery, cut thinly and with rough threads pulled off, 1 garlic clove, peeled and minced, peeled and chopped into bits, 200 grams russet potatoes, 500 milliliters vegetable stock, 100 milliliters of milk, a loaf of crusty bread to be served. Directions: in a large skillet, heat the oil over a medium heat until shimmering. Add the celery, garlic, and potatoes and toss to cover with oil. Prepare the vegetables by adding a splash of water and seasoning with salt, then cook them while stirring continuously for 15 minutes, adding extra water as necessary if the vegetables begin to stick. Pour in the vegetable stock and bring to a boil, then reduce the heat to a low setting and continue to cook for another 20 minutes, or until the potatoes are falling apart and the celery is tender. Puree the soup in a stick blender, then pour in the milk and process again until smooth. Season with salt and pepper to taste. Serve with a crusty piece of bread. 7.3.3 Frittata with a masala sauce and avocado salsa. Ingredients: 2 tablespoons of rapeseed oil, 3 onions, 2½ thinly sliced and 1/2 coarsely chopped, 1 tablespoon Madras curry paste, 250 grams cherry tomatoes, peeled and halved, 2 tablespoons de-seeded and coarsely chopped red chili, coriander leaves from a small bag, coarsely chopped, 8 big eggs, well beaten, 1 avocado, peeled and cubed after it has been stoned. Squeeze the juice of 1 lemon. Direction: in a medium nonstick oven-proof frying pan, heat the oil until shimmering. Cook for approximately 10 minutes or until the onions are tender and golden, over a medium heat, stirring occasionally. After 1 minute, add the madras paste and sauté for another minute before adding half of the tomatoes and half of the chili. Cook until the sauce has thickened and the tomatoes have all burst, about 15 minutes more. Preheat the grill to a high setting, toss half of the coriander into the eggs, season with salt and pepper, and then pour over the spicy onion combination. Cook for 8 to 10 minutes over a low heat, stirring gently once or twice until the mixture is nearly set. Transfer on the grill for 3 to 5 minutes or until the cheese is melted. To prepare the salsa, combine the avocado, remaining chili and tomatoes, chopped onion, remaining coriander, and lemon juice in a large mixing bowl until well combined. Season with the salt and pepper and serve with the frittata. 7.3.4 Egg muffins that are simple to make. Ingredients: 1 tablespoon extra virgin olive oil, 1 pound finely chopped broccoli, 1 red pepper peeled and cut finely, 2 spring onions finely chopped, 6 quarts of big eggs, 1 tablespoon whole milk, a generous amount of smoked paprika, 50 grams grated cheddar or Gruyere cheese, a small handful of finely chopped chives. Directions: preheat the oven to 200 degrees Fahrenheit, 100 degrees Celsius. Half of the oil should be brushed into an 8-hole muffin tray. In a frying pan, heat the remaining oil and add the broccoli, pepper, and spring onions. Cook until the broccoli is crisp tender. Fry for 5 minutes over medium heat. Remove from the oven and set aside to cool. In a large mixing bowl, whisk together the eggs, milk, smoked paprika, and half of the cheese until well combined. Cooked vegetables should be added at this point. Fill the muffin holes halfway with the egg mixture, then top each with the remaining cheese and the sprig of chives if you like. Bake for 15 to 17 minutes or until the top is golden brown and the chicken is cooked through. 7.3.5 Soup made with cauliflower. Ingredients: 1 big cauliflower floret, 12 tablespoons ground cumin, 2 tablespoons extra virgin olive oil for drizzling, 4 sprigs of thyme, 1 medium-sized onion, coarsely chopped, 1 celery stick, finely chopped, 1 garlic clove, peeled and mashed, 700 to 850 milliliters vegetable or chicken broth, 100 milliliters of cream, finely chopped parsley, about 12 tiny bunches total. Direction: preheat the oven to 220 degrees Fahrenheit, 200 degrees Celsius. In a roasting pan, toss the cauliflower florets with 1 tablespoon olive oil, the cumin, and the thyme until well coated. Roast for 15 minutes or until the potatoes are golden and soft. Remove the thyme and set aside. Stirring constantly, cook the onion and celery for 10 minutes or until softened in the remaining oil in a large saucepan over a medium heat. Cook for 1 minute after adding the garlic. Stir in most of the cauliflower, keeping a few florets for sprinkling on top of the soup later. To make the stock, add 700 milliliters to a saucepan and bring it to a boil. Cook for 10 minutes at a low heat. Using a hand blender or food processor, mix the soup until it is completely smooth. Season with salt and pepper to taste after stirring in the cream. If you want your soup a bit thinner, you may add a little more stock. Pour the soup into bowls and top with the parsley, cauliflower that has been saved, and an additional drizzle of olive oil. 7.3.6 Fish fillets baked in the oven. Ingredients: 4 skinless salmon fillets, 1 tablespoon extra virgin olive oil. For garnish, combine finely chopped herbs, lemon wedges, and cooked long-stem broccoli. Directions: preheat the oven to 180 degrees Fahrenheit, 160 degrees Celsius. Season each salmon fillet with salt and pepper after brushing with oil or butter. Place the salmon fillets in a baking dish that can withstand the heat. Cover the pan if you like your salmon to be delicate, or leave it exposed if you prefer the meat to be tougher. Roast for 10 to 15 minutes, or around 4 minutes per 1 centimeter thickness, or until the salmon is barely opaque and can easily be flaked with a fork, depending on how thick it is. Add a sprinkle of chopped herbs, a few lemon slices, and cook long-stemmed broccoli, if desired, to the dish before serving. 7.3.7 Garden salmon salad. Ingredients: 2 courgettes, 100 grams shelled fresh peas, 8 radishes peeled and halved, 3 tablespoons of rapeseed oil, 1 medium-sized lemon, zested and juiced, 2 tablespoons low-fat natural yogurt, 75 grams pea shoots, 4 poached salmon fillets with the skin removed and flaked into big bits, 2 tablespoons of mixed seeds, 12 tiny bunches of dill with the fronds plucked. Directions. With a peeler, peel the courgettes into long, thin strips, removing the soft, seeded core from the middle. A big mixing basin is ideal for combining the courgette ribbons, peas, and radishes. Toss the vegetables with oil, lemon zest and juice, and yogurt after whisking them together. Prepare a big dish by arranging the pea shoots, seasoned vegetables, and large flakes of salmon on it. Finalize with a generous grind of black pepper, then serve with scattering of mixed seeds and dill for garnish. 7.3.8 Eggs with avocado and black beans. Ingredients. 2 tablespoons rapeseed oil, 1 red chili, de-seeded and thinly sliced for garnish, 1 big clove of garlic peeled and sliced, 2 big eggs about, 400 grams canned black beans drained, 12.4 grams canned cherry tomatoes in a 12-pack, 14 teaspoons of cumin seeds, 1 small avocado, peeled and split, thinly sliced, a handful of finely chopped fresh coriander, 1 lime, peeled and sliced into wedges. Directions. In a large nonstick frying pan, heat the oil until shimmering. Cook until the chili and garlic are softened and beginning to color about 5 minutes. Crack the eggs into the pan on each side of the pan. Once they have begun to set, ladle the beans with their juice and the tomatoes about the pan and sprinkle the cumin seeds to finish cooking them off. Instead of cooking the beans and tomatoes, you want to warm them up a little bit. Remove the pan from the heat and distribute the avocado and coriander on top of the mixture. Half of the lime wedges should be squeezed over the top. Serve with the leftover wedges on the side so that you may squeeze them over the top. 7.3.9 Soup with mushrooms. Ingredients. 90 grams of butter, 2 medium-sized onions coarsely chopped, 1 garlic clove peeled and smashed, 500 grams of finely sliced mushrooms, chestnut or button mushrooms work well, 2 tablespoons unbleached all-purpose flour, 1 liter of boiling chicken stock, 1 bay leaf, 4 tablespoons undiluted single cream. To serve, a tiny bunch of flat-leaf parsley that has been coarsely chopped. Directions. In a large saucepan, melt the butter over medium heat and sauté the onions and garlic until tender but not browned, approximately 8 to 10 minutes. Toss in the mushrooms and cook for another 3 minutes over high heat or until they are tender. Using a fork, mix in the flour until everything is well combined. Cook for a further 10 minutes after adding the chicken stock and bay leaf. Take the bay leaf and set it aside, then remove the mushroom combination from the heat and puree it with a hand mixture until everything is completely smooth. To finish, slowly reheat the soup, stirring in the cream. You could even freeze the soup at this point and then reheat it later, stirring in the cream as you go along. Serve with a scattering of parsley if you want. 7.3.10 Curry made with cashews. Ingredients. 1 small onion peeled and chopped, 3 to 4 garlic cloves, a piece of ginger the size of a thumb peeled and coarsely chopped, 3 green chilies de-seeded and minced, a small bunch of coriander leaves plucked and stalk coarsely chopped, 100 grams cashews that have not been salted, 2 tablespoons of coconut oil, 1/12 tablespoon marsala, 400 gram canned chopped tomatoes, 450 milliliters of chicken broth, 3 big chicken breasts with any visible fat removed and cut into bits, 155 grams fat-free yogurt, a single cream of 10 milliliters, 165 grams boiled or cooked greens. Directions. Place the onion, garlic, ginger, chilies, and coriander stems in a small food processor and pulse until they are a paste. Remove from the processor. Using a large nonstick frying pan, cook the ingredients over a medium heat. Toss in the cashews and toast for 1 to 2 minutes or until they are light golden in color. Remove off the heat and place the pan back on the stove. Stir-fry the paste for 5 minutes to soften it before adding the oil. Cook for a further 2 minutes after adding the garam masala. Toss the tomatoes and stock into the pan and heat through. Mix well, then transfer to a blender along with cashews and process until smooth and creamy. Return the pan to heat, season with salt and pepper, and bring to a boil before reducing heat to a simmer. Allow 30 minutes to pass or until the sauce has thickened before adding the chicken and covering with the lid for another 15 minutes or until the chicken is cooked through. To prepare a creamy sauce, combine the yogurt and cream, if using, in a large mixing bowl. Serve with coriander leaves scattered on top and the greens alongside. 7.4 Dinner Recipes for Dinner. 7.4.1 Chicken Pizza Crust. Ingredients: 1 pound boneless, skinless, shredded chicken breast, 1 cup shredded mozzarella cheese, 2 big eggs, season with salt and pepper to taste. Directions: use a spoon, spatula, or your fingers. Thoroughly combine all of the ingredients together. Press the chicken firmly onto parchment paper. Spread it as thin as possible without creating holes in the paper. Bake for 20 minutes or until the sides are browned and the top is beginning to color slightly. Depending on your oven, you may need to bake it for a longer period of time. Top with your preferred pizza toppings and bake for another 10 minutes to finish the job. Make a slicing motion and serve. Use a fork to savor this dish. In the oven or microwave, this dish reheats well. This recipe serves 4. The crust contains 1 carb for every quarter of the recipe's total carbohydrates. 7.4.2 Stuffed peppers in the crock pot with ground turkey. Ingredients: bell peppers, tops, seeds, and membranes removed from each pepper, 1 pound 93.7 turkey ground meat, 1/2 cup finely diced sweet onion, 1½ cups cooked rice, 12 teaspoons garlic powder, 1 teaspoon of salt, 14 teaspoons cayenne pepper, 1 teaspoon dry herbs, thyme or rosemary finely chopped, 1/12 teaspoon Worcestershire sauce, 1/4 cup water, 1 12-ounce can of tomato sauce, 12 cups shredded mozzarella cheese, and parsley as an optional garnish. Directions: cut the tops off of 6 bell peppers, red, yellow, green, or orange, and remove the seeds and membranes. Place the peppers in a large mixing bowl. Keep the tops aside for later. In a large mixing bowl, add the uncooked ground turkey, chopped onion, and cooked rice, as well as 1/4 teaspoon garlic powder, salt and pepper to taste, 1/2 teaspoon dried herbs, and 1 teaspoon Worcestershire sauce. Combine until everything is well combined. Use equal portions of the turkey rice mixture and stuff bell peppers with them. Place the bell peppers in a 6-quart slow cooker and cover with their tops. Pour 1/4 cup water into the bottom of the slow cooker and simmer for 4 hours on high or up to 8 hours on low for a hearty, satisfying meal. During the final 30 minutes of simmering in a medium-sized mixing bowl, stir together tomato sauce, 1/4 teaspoon garlic powder, 1/2 teaspoon dried herbs, and 1/2 teaspoon Worcestershire sauce. Remove the tops off the bell peppers and spoon tomato sauce over the tops of the peppers. Finish cooking for the remaining 30 minutes, if preferred, by sprinkling with mozzarella cheese. Make a tiny incision in the bottom of the bell peppers just before serving to allow any extra liquid to drain out. 7.4.3 Sprinkle fresh parsley on top of bell peppers. Ingredients: 2 tablespoons soy sauce with a reduced salt content, 1 teaspoon of Dijon mustard, 1 teaspoon chili paste, 1 teaspoon sesame oil that has been roasted, cubed chicken breasts cut into 1/2 inch cubes, season with freshly ground pepper to taste, green onions coarsely chopped, about 1/2 cup total, 1/4 cup finely sliced carrots, 1 garlic clove peeled and minced, 1/4 cup short grain brown rice fully cooked, 1/4 cup thawed frozen peas, 2 big egg whites, spray with extra virgin olive oil. Directions: to make the sauce, mix the soy sauce, mustard, chili paste, and sesame oil in a small dish. Make a mental note to put it away. Season the diced chicken breast with freshly ground black pepper. Cook over the medium-high heat until a drop of water sizzles on the bottom of a large nonstick wok or pan that has been misted with a cooking spray. Distribute the chicken chunks evenly across the wok or pan. Cook, tossing periodically, until the chicken is browned on both sides and the interior is no longer pink. Transfer the chicken to a platter and cover with aluminum foil to keep it warm. Lightly spritz the wok or pan with cooking spray one more time to finish cooking. Preheat the pan over medium-high heat. Toss in the green onions, carrots, and garlic to the pan and heat through. Cook for 2 to 3 minutes, stirring often until the sauce is thick. Stir in the cooked rice and peas until well combined. Cook, stirring consistently, for another 2 minutes or until the mixture is heated throughout the mixture. In the middle of the pan, using the back of a spoon or spatula, make a hole in the rice and vegetables. Remove the pan from the heat and gently spritz the exposed portion of the pan with cooking spray. Stir in the egg whites until they have been evenly distributed throughout the rice. Continue to simmer for another 1 to 2 minutes or until the egg is fully cooked. Return the chicken to the pan and toss in the soy sauce mixture that has been set aside. Cook for approximately 1 minute, stirring regularly or until the mixture is cooked through, serving as soon as possible. 7.4.4 Soup with pumpkin and black beans. Ingredients: 2 tablespoons extra virgin olive oil, 1 medium onion peeled and sliced, 4 garlic cloves peeled and minced, 1 tablespoon cumin seeds ground, 1 teaspoon cayenne pepper powder, 1/2 teaspoon fresh ground black pepper, 2 cans 15 ounces washed and drained black beans to taste, 1 cup of chopped tomatoes from a can, 2 quarts of beef broth, 1 pumpkin puree can. Directions: over medium heat, sauté the onions, garlic, cumin, chili powder, and pepper until they are tender. Transfer to a soup kettle and cover with water. Combine the black beans, tomatoes, broth, and pumpkin in a large mixing bowl. Stir periodically while cooking for around 25 minutes or until the soup has reached a thick consistency. Serve as is or puree with an immersion blender for a smoother consistency if desired. 7.4.5 Baked tomatoes. Ingredients: 5 to 6 big tomatoes. Spray with extra virgin olive oil, 1/4 cup shredded low-fat Parmesan cheese, a pinch of Greek seasoning, 1/4 cup pine nuts. Direction: preheat the oven to 350 degrees Fahrenheit. Cut the tomatoes in half lengthwise and set them open-faced in a 9 by 13 inch nonstick baking pan. Lightly mist the surface of the tomatoes with olive oil spray. Cover with a layer of cheese and pine nuts. Season with Greek spice to taste and serve. Bake for 50 minutes on the center shelf of the oven. 7.4.6 Recipe for Thai tofu quinoa bowls. Ingredients: 1 package extra firm tofu chopped, 2 tablespoons tamari or soy sauce, 1 tablespoon sesame oil, 1 cup quinoa, 1/2 cup chicken broth, 1/2 cup slivered almonds, 1 cup shredded carrots, 1/3 cup finely chopped scallions, 1/2 cup chopped fresh cilantro, 2 tablespoons creamy peanut butter, 2 tablespoons hot sauce, 2 tablespoons rice wine vinegar, 3 tablespoons coconut milk, 1/2 tablespoon brown sugar, 1 garlic clove peeled and chopped, 1 lime freshly squeezed, 1 teaspoon grated ginger. Direction: drain and rinse tofu 30 minutes before you start cooking. Fold a clean dish towel over the top and place on a large dinner plate. Over the top of the first plate, place another plate and weigh it down with something heavy to push out some of the extra liquid. Allow yourself 15 to 30 minutes of resting time. Preheat the oven to 350 degrees Fahrenheit. In a large mixing bowl, combine the tofu, soy sauce, and sesame oil. Arrange the tofu in a single layer on a baking sheet coated with parchment paper. Place the tofu in the oven for 35 to 40 minutes, flipping every 10 minutes until it is crisp on both sides. Prepare the quinoa by toasting it and cooking it. Heat a medium-sized saucepan over medium heat, stirring occasionally. Sprinkle dry quinoa over the top and toast for 5 minutes, stirring regularly until the grains are golden brown. Add broth to the quinoa and turn down the heat a notch. Cook covered for 12 to 15 minutes or until all of the liquid has been absorbed. Using a fork, fluff the mixture and put it aside. Prepare the sauce by doing the following steps. Place the peanut butter in a microwave-safe bowl and heat for 10 seconds to melt it. Whisk in the other ingredients until everything is well combined. 7.4.7 Lightly toast the almonds. Ingredients: using cooking spray, 1 pound boneless skinless pork tenderloin sliced thinly into pieces, 15 ounces of canned pineapple chunks, 1/2 cup of water, 1/4 cup Splenda and brown sugar mixture, 2 tablespoons of cornstarch, 1/2 teaspoon of table salt, 1 tablespoon soy sauce with reduced sodium, 2 medium-sized green peppers thinly sliced as tolerated, 1 small onion peeled and sliced as tolerated, 3 cups brown rice that has been cooked, 1/3 cup of wine vinegar. Directions: Heat a nonstick skillet coated with cooking spray over medium-high heat until hot but not smoking. Add the meat and heat until the pork is golden brown. Remove the skillet from the heat and put aside. Remove any residual fat from the skillet and set aside. Drain the pineapple chunks, saving the juice, and put the pineapple chunks aside. In a small mixing bowl, combine the water, vinegar, sugar, cornstarch, salt, soy sauce, and pineapple juice that has been set aside. Cook for approximately 2 minutes, stirring constantly until the sauce has thickened. Add the pork to the pan and simmer on low heat, turning regularly for about 30 minutes or until the meat is cooked. Add the peppers, onions, and pineapple pieces and simmer for another 5 minutes, stirring occasionally. Serve with a side of rice. 7.4.8 Recipe for Barbecue Roasted Salmon. Ingredients: 1/4 cup pineapple juice, 2 tablespoons freshly squeezed lemon juice, 4 salmon fillets drained and rinsed, 2 tablespoons brown sugar, 4 tablespoons chili powder, grated lemon rind, 1/4 teaspoon of ground cumin, 1½ teaspoons of salt, 1/4 teaspoon ground cinnamon. Directions: preheat the oven to 400 degrees Fahrenheit. Place the first 3 ingredients in a Ziploc bag and seal the bag. Refrigerate for 1 hour, turning regularly to allow flavors to blend. Remove the salmon from the bag and throw away the marinade. Combine the remaining ingredients and massage them into the fish. Place the fillets in a baking dish that have been sprayed with cooking spray. Prepare the dish for baking for 12 to 15 minutes or until desired doneness is reached. Garnish with lemon slice if desired. 7.4.9 Frittata with spinach. Ingredients: vegetable oil, 1 medium onion peeled and sliced, 2 cups thawed and drained frozen chopped spinach, 1/2 cup shredded reduced fat cheddar cheese finely chopped, 4 egg whites, 2 boiled eggs, 1/3 cup cottage cheese with reduced fat, 1/4 teaspoon cayenne pepper, 1/4 teaspoon of salt, 1/8 teaspoon ground nutmeg. Directions: preheat the oven to 375 degrees Fahrenheit. Prepare a 9-inch pie pan by spraying it with vegetable oil spray. In a medium pan, heat the oil over medium heat until shimmering. Toss in the onion and simmer for 5 minutes or until tender. Add the spinach and simmer for another 3 minutes, then remove from heat and put aside. Sprinkle cheese on the bottom of the pie plate. To finish, top with the spinach and onion combination. In a medium-sized mixing basin, whisk together the egg whites and the whole eggs, the cottage cheese, the cayenne pepper, the salt, and the nutmeg. Pour the mixture into the pie pan and spread it over the spinach and cheese. Bake for 30 to 35 minutes or until the center is barely set. Allow for 5 minutes of resting time. Cut into wedges and serve immediately. 7.4.10 Meatloaf Muffins. Ingredients: 1 packet, about 1.25 pounds, ground turkey breast that is 99% fat-free. A piece of whole wheat or multigrain bread or 1/2 cup store-bought breadcrumbs. 1 cup finely diced onions. Eggland's Best eggs. Worcestershire sauce. Sweet Baby Ray's barbecue sauce or your favorite barbecue sauce, 1/2 cup. 1/4 teaspoon of salt. Peppercorns freshly powdered to taste. Directions: preheat oven to 350 degrees. Coat a normal 12-cup muffin tray with cooking spray. Since this recipe creates 9 meatloaf muffins, you'll only fill 9, not 12. Make a mental note to put it away. To create breadcrumbs, toast 1 slice whole wheat or multigrain bread, place in blender, and pulse until formed into crumbs. In a large bowl, mix ground turkey, breadcrumbs, onions, egg, Worcestershire sauce, 1/2 cup barbecue sauce, salt, and pepper. Using your hands or a big spoon, thoroughly stir together until fully integrated. Add meatloaf mixture to the 9 muffin cups, smoothing down the tops. Top each meatloaf muffin with 3/4 tablespoon barbecue sauce and distribute it evenly over top. Bake for 40 minutes. Run a knife around each muffin to dislodge it from the pan. Remove to a serving dish.